Good afternoon, sir.
Very good afternoon.
Sir, shall we start the program, sir? Or Murali sir has joined.
Yeah,
Yes, sir. Murali sir has
okay.
joined. Latha madam has joined, and Indu madam has also joined, sir.
Yeah. Now people are J3. Okay.
Good afternoon, sir.
Very good afternoon. Very good afternoon.
Good afternoon, sir. I'm Latha.
Good afternoon. Yeah. 96. Maybe once we cross, we will start.
Okay, sir.
We are I think we can.
Sir, sir, shall we start the program, sir?
Yeah, sure. We can start.
Good afternoon, everybody. Before we start the program, I request all the participants to kindly mute your mic audio. I request all the participants to kindly mute your mic audio for the smooth functioning of program. Thank you. Kerala University of Health Sciences wholeheartedly welcome each one of you to a collaborative program of Center for History of Medicine and Health Humanities and Center for Studies on Health of Young Adults. Observance of World Health Day with the theme Building a Fairer, Healthier World. With great sense of gratitude and respect, I sincerely welcome our Honorable Vice Chancellor, Professor Dr. Mohanan Kundumal sir, to this auspicious occasion. On behalf of both the centers, I welcome you to the program, sir. Welcome, sir. I feel extremely enthusiastic to welcome our Pro Vice Chancellor, Professor Dr. Vijayan sir, to this program. I wholeheartedly welcome you, sir. It gives me immense pleasure in welcoming our Registrar, Professor Dr. A.K. Manoj Kumar sir, to this program. Welcome, sir. I also welcome our Controller of Examination, Professor Dr. Anil Kumar sir, Dean Research, Professor Dr. Shaji sir, Dean Student Affairs, Dr. Iqbal sir, to this program. Welcome, sirs. I feel highly honored to welcome our eminent speaker of today's program, Dr. Muralee Thummarukudy sir, who is currently the Operations Manager, Crisis Management Branch, United Nations Environment Program, Geneva, Switzerland. Sir, in spite of his busy schedule, instantly accepted our request and expressed his willingness to be a resource person for our program. With great sense of pleasure and extreme gratitude, I welcome you, sir, to this program. Welcome, sir. Our next eminent resource person is Dr.C.Latha. Madam is currently the Dean of Kerala Veterinary and Animal Sciences University. Madam is also the Professor and Head Veterinary Public Health in Thrissur. And Madam has wholeheartedly accepted our invitation to be a resource person. I feel extremely proud to welcome you to this program, ma'am. Welcome, Madam. Our next vibrant speaker for today is Professor Dr. Indu, Madam. Madam is currently the Professor and Head of Department of Community Medicine, Govt.Medical College, Thrissur. With great enthusiasm and warmth, I welcome you, ma'am, to this program. Welcome, ma'am. I extend my sincere and wholehearted Welcome to all the participants, principals, faculty members, students, and all the eminent participants who have joined this program. I, on behalf of both the research centers and Kerala University of Health Sciences, extend a hearty welcome to each one of you. Welcome all. Next, I would like to invite our Honorable Vice Chancellor, Professor Dr. Mohan Kundumal sir, to inaugurate the program and deliver the inaugural address. Sir, please.
Sir, mute ആണ്.
Yeah. Okay. Good afternoon. Respected my fellow Pro Vice Chancellor, Dr. C.P. Vijayan, respected invited speakers of today's function, Dr. Muralee Thummarukudy, internationally renowned disaster management expert from United Nations, Geneva, Professor C.Latha, Dean of Kerala Veterinary and Animal Sciences University, and expert on the concept of One Health, Professor P.S.Indu, Head of Department of Community Medicine, Govt.Medical College, Thrissur, and the leading expert in the COVID management team of Government of Kerala. My dear colleagues in the university, respected faculty members of the affiliated colleges, my dear students, ladies and gentlemen. Kerala University of Health Sciences is extremely happy to celebrate the World Health Day today on the 7th of April. The importance of this day, 7th of April, is that it was on this day, World Health Organization, that is WHO, approved its constitution in 1948. After that, 7th April is celebrated as World Health Day all over the world. Every year, there will be a theme, and this year's theme, as it has been said, is building a fairer, healthier world. When the whole world continued to suffer due to COVID-19 pandemic, there cannot be a better theme than building a fairer, healthier world. We are not living in a fair world. Inequality is not an exception, but the rule. The rich-poor divide has become acute in the face of the pandemic. Even though every disaster can affect all human beings and all countries, the impact will be different according to the status of the country, status of the population, and status of the individual. Recently in Kerala, we have seen that floods affected the poor very severely with loss of life and livelihood. When the COVID pandemic struck us, when the country went to lockdown in March 2020, lakhs of poor migrants, laborers were forced to leave their working place and walk thousands and thousands of kilometers to their home. So the rich-poor divide is very severe when you face a pandemic. The COVID pandemic taught us one more thing. Human health has no isolated existence. It is deeply interlinked with animal health, forest health, and environmental health. The first microbe on Earth, we may realize that appeared 4 billion years ago, and human beings came to the universe only 8 lakh years ago. So microbes were much senior to us. And there are only 800 crore human beings in the earth. But when you count the number of microbes, you cannot say the number. It is actually 1 followed by 30 zeros. And human beings, 8 followed by 9 zeros only. So that is the huge number of microbes in the whole universe. And therefore, it is said that 1 liter of seawater will contain 10 billion viruses. So that is the data. And compared to that number of all the living beings, we are a very insignificant minority. But we have been causing a lot of damage to the ecology, and now we are suffering due to that changes we make in the ecology. We know that recently Nipah killed few people in Calicut, and this Nipah originated from bats. And these bats, it is said that they lost their home in the forest and they came to us. Similarly, Corona 19 may be from the wet market of Wuhan or a rogue lab in Wuhan. We don't know, and we will never know that. But all these has to be analyzed, all these has to be studied, and we have to be prepared for similar problems in the future. It's the main duty of the health university. The main function is to create sufficient number of professionals who are capable of facing challenges in the health field, and that is the very purpose of this webinar also. I am very happy to note that Dr. Muralee Thummarukudy is here with us. He is an international expert with a lot of experience in managing disasters, and he will enlighten us on the relationship of environment and changes in climate on health. The concept of One Health and the control of Zoonoses, I hope, will be elaborated by Professor Latha, and all of us will have to work together for One Health. And I hope Professor Indu will give us a blueprint how we can work together. At the Kerala University of Health Sciences, we are committed to work together with all the stakeholders for creating a fairer, healthier world. With these few words, I declare this webinar on the World Health Day inaugurated. Thank you.
Thank you, sir, for sharing with us your words of wisdom. Next, I would like to invite our Pro Vice Chancellor, Professor Dr. C.P. Vijayan, sir, to felicitate the gathering. Sir, please.
Vijayan, unmute.
Yes. കേരള ആരോഗ്യ ശാസ്ത്ര സർവകലാശാലയുടെ ആദരണീയനായ വൈസ് ചാൻസലർ പ്രൊഫസർ മോഹനൻ കുന്നുമ്മൽ, സർവകലാശാലയുടെ അധികാരികൾ, ഇന്നത്തെ പ്രഭാഷകരായ ഡോക്ടർ മുരളി തുമ്മാരുകുടി, ഡോക്ടർ.C.Latha, Dr.P.S.Indu, ആതിഥേയരായ ഡോക്ടർ അനൂപ്, ഡോക്ടർ സന്ധ്യ, faculty of Kerala University of Health Sciences, students and other audiences. ഇന്ന് ലോകാരോഗ്യ ദിനത്തില് അതിൻ്റെ തീം, അതിനെക്കുറിച്ചെല്ലാം വളരെ വിശദമായിട്ട് നമ്മുടെ ബഹുമാന്യനായ വൈസ് ചാൻസലർ പറഞ്ഞു കഴിഞ്ഞു. അവിടെ എടുത്തു പറയേണ്ട ഒരു കാര്യം, മനോഹരമായ അല്ലെങ്കിൽ കൂടുതൽ മനോഹരമായ, കൂടുതൽ ആരോഗ്യകരമായ ഒരു ലോകം കെട്ടിപ്പടുക്കുക എന്നുള്ള ഒരു സന്ദേശമാണ് ലോകാരോഗ്യ സംഘടന നമുക്ക് നൽകുന്നത്. കൂടുതൽ മനോഹരനായ, കൂടുതൽ ആരോഗ്യവാനായ ഒരു മനുഷ്യനെ സൃഷ്ടിക്കാനല്ല പറഞ്ഞിരിക്കുന്ന, ഒരു ലോകം കെട്ടിപ്പടുക്കാനാണ്. അതായത് ഈ ലോകത്ത് ജീവിക്കുന്ന സമസ്ത ചരാചരങ്ങൾക്കും അതുപോലെ ഈ പരിസ്ഥിതിക്കും എല്ലാം ആരോഗ്യമുണ്ടായെങ്കിൽ മാത്രമേ മനുഷ്യൻ അതിലെ ഒരു അംഗമെന്ന നിലയിൽ ആരോഗ്യവാനാകുകയുള്ളൂ, സന്തോഷിക്കുകയുള്ളൂ എന്നുള്ള ആ ഒരു സന്ദേശമാണ് ലോകാരോഗ്യ സംഘടന നൽകുന്നത്. തീർച്ചയായിട്ടും അതിന് ഈ ഒരു സന്ദേശത്തിന് സർവഥാ യോഗ്യരായ പ്രഭാഷകരെയാണ് നമുക്ക് ഇന്ന് ലഭിച്ചിരിക്കുന്നത്. ഡോക്ടർ മുരളി തുമ്മാരുകുടി, Dr.C.Latha ഫ്രം ആനിമൽ യൂണിവേഴ്സിറ്റി, ആനിമൽ ഹസ്ബൻഡറി യൂണിവേഴ്സിറ്റി, ആൻഡ് അവർ ഓൺ ഫാക്കൽറ്റി ഡോക്ടർ ഇന്ദു. തീർച്ചയായിട്ടും ഈ പരിപാടി നമ്മുടെ ആരോഗ്യ പ്രവർത്തകരുടെ മുഴുവൻ കണ്ണു തുറപ്പിക്കുമെന്ന് ഞാൻ പ്രതീക്ഷിക്കുന്നു. ഈ ഒരു പരിപാടിക്ക് മാത്രമല്ല, കൂടുതൽ മനോഹരമായ, കൂടുതൽ ആരോഗ്യകരമായ ലോകം കെട്ടിപ്പടുക്കുവാനുള്ള നമ്മുടെ എല്ലാ പ്രയത്നങ്ങൾക്കും വിജയാശംസകൾ നേർന്നുകൊണ്ട് ഞാൻ നിർത്തുന്നു. താങ്ക് യു.
Thank you, sir, for your motivating words. Now I invite Dr. Sandhya to kindly introduce our first speaker of the day, Dr. Muralee Thummarukudy, sir.
Thank you, Dr. Anu. So, the first speaker of today's program is Dr.Muralee Thummarukudy, sir. Sir will be delivering a talk on the topic Health, Environment and a Changing Climate. Since Sir has got some preoccupied commitments, soon after his talk, the session will be open for discussion. I request all the participants to kindly post your questions in the chat box. Now, to give a brief introduction, I consider myself highly honored and privileged to introduce our eminent speaker, Dr. Muralee Thummarukudy, sir. Sir is currently the Operations Manager of Crisis Management Branch at United Nations Environment Program based in Geneva, Switzerland. Dr. Thummarukudy, sir, holds a PhD in Environmental Engineering from Indian Institute of Technology, Kanpur. He is an alumnus of the International Leadership Academy, United Nations University and a Beers Fellow at the University of California, Berkeley. Dr. Thummarukudy, sir, has over 25 years of experience in environment and disaster management around the world. Between 1995 to 2003, he was a corporate advisor to Shell Group oil companies in Middle East and Southeast Asia, dealing with oil industries related emergencies. Dr. Thummarukudy, sir, is also a prolific writer in Malayalam and winner of Kerala Sahitya Academy Awards in 2017 and 2018. With this brief introduction, I wholeheartedly welcome Dr. Thummarukudy, sir, to deliver his talk. Sir, please.
Thank you, Dr. Sandhya. Good afternoon to my fellow citizen friends back in Kerala, Honorable Vice Chancellor, Pro Vice Chancellor, and my fellow panelists. It is indeed an honor for me to be invited to the Kerala Health University. Though I spent most of the time outside Kerala, I had always made it a point to visit most of the universities in Kerala. But I have not had the pleasure of visiting the Kerala Health University, and I'm looking forward to it, maybe during my next visit or the visit after. But I'm talking to you, doctors, at a time when you are seen as the saviors of the world, the frontline warriors of the COVID war. And I know probably all of you are overworked over the last 12 months. It has been a tremendous strain on doctors around the world, and hundreds of you have lost your lives in this battle. And I have many of my friends who are in medical profession. And I talk to them almost every day as to how things are progressing. They're tired for sure. The battle is relentless. And if the signals emerging in the last 15 days is true, we are not looking at the beginning of the end. We are actually more looking at the end of the beginning. The next wave is about to start. In some part of India, it has already started. But I also tell them that you are living in truly historic times. There will be a time, and that time will come for sure, maybe in 2 years, when we will be able to look back at this period and say, this was the most golden period of the medical profession. For those who are in the medical profession at this point of time, there's no time like this in your professional career, and hopefully there'll be no time like this in future, where all your skill and training and attitude were put to test. I'm also so proud that there was not even one incident when a medical professional decided not to go to work because they were afraid for their own life. The starting phase of this COVID, there was not enough knowledge, there's not enough treatment methodology, there was not even enough of personal protective equipment. In spite of this, our doctors got up every morning and then went to work. Some of them with very young children, and some of them could not see their young children for days and months. And for this tremendous sacrifice for the society and dedication and commitment, I congratulate and I thank you on behalf of all humanity. I also tell my friends who are medical students, saying that you are also in historic times. Some of them are learning online. And I have my friend's daughter here in Geneva, who is in the 5th year. She is also learning online. I was surprised. I understood that in Kerala, probably after the 3rd year, the students are in the universities. But here in Switzerland, even the pre-final year students are still doing online classes. And some of us joke that when you look at a doctor in future, you should look whether they passed through during this COVID period as to whether they actually went through enough practical lessons. But these are also historic times for a change in learning practice. That learning switched whole scale from classroom into online. And debate is still on that if it is an effective way of teaching. Teaching clearly is not about imparting knowledge. Teaching is also about forming networks, and that will not happen online. So therefore, absolutely teaching has to go back to college. But there is this question as to whether you can teach a topic like medicine online. And many people think it is not going to be possible. But I actually believe that more and more teaching of every topic, be it medicine, be it mathematics, be it philosophy, be it plumbing, they will all go online. And people ask me, how will you teach practical sessions? And this is very important because doctors cannot be trained without practical sessions. But it is possible to teach practical sessions also online. I had been to the National Firefighting School of France 3 years back. And this is where all the senior firefighting officers are trained, including pilots, including fire engine drivers, including operators of firefighting machines. And they are all put through tremendous amount of training in simulators in a small town, almost a village in France. But they have live 3D images of almost every facility in France. They can see the Eiffel Tower in 3 dimensions in live. They can see almost every street in Paris in 3 dimensions in live. So as they practice, they are actually able to do a lot more practice than what would be possible if one were to do physical training. And this is what is going to happen to training. That even in medical training, tremendous amount of training will go into simulation mode. And I think that's a very good and positive thing to happen. I know my topic today is not about online training, but I cannot move into my training and my topic without talking about the sweeping changes which are happening in the world, which is also going to impact medicine. In late 2019, I had decided that in Kerala, in 2020, I will only speak about one topic, that's artificial intelligence. What are the changes which AI is going to bring to Kerala, to the world, and how Kerala will be impacted? The reason why I decided to do that is because I had a chance meeting with a minister from United Arab Emirates. And his name is Mr. Olama. And he was a minister for artificial intelligence. And he's the only minister for artificial intelligence in the world. But there is such a minister. He was only 28 at that time. He was appointed when he was 27. And he explained how the government of Dubai have decided that by 2030, Dubai would be the superpower of AI, and they'll be leading the AI revolution. And he said that every sector of Dubai economy would be affected by AI, be it health, be it education, be it transport, be it any other topic. That's when I started looking tremendously into what's going to happen in AI. And then I learned that big things are about to happen. Millions of jobs, hundreds of millions of jobs will be eliminated. An Oxford University study says that by 2030, 46% of all existing jobs would vanish. And 2030 is just 10 years away. And people often assume that the jobs which will vanish are low-end jobs. No, the jobs which will be affected would be across the board. And the doctor's job is no exception. Professor Hindren, who works part-time in Google, said that training radiographers is obviously a waste of time. This is what he says in 2016, because machines would read and interpret images much better than human beings could ever do. And in terms of diagnosis, in terms of prescribing, in terms of operation, machines are going to be able to do much more than what they are doing now and much better than what human beings can do. I'm saying this partly to provocate you so that you would ask questions. Also saying this so that you would start to read more about the AI revolution which is sweeping us. I tell people increasingly these days that if you thought COVID was like a wave coming at you, a big wave as you are standing by the beach, then the fourth industrial revolution, which is prime moved by artificial intelligence, is like a tsunami which is coming behind. So if you think you have survived COVID, that's a good thing, but you have to brace for something which is bigger and larger. As Kerala University of Health Sciences, you also have this tremendous responsibility. How do you prepare future ready doctors today? The skills you impart should not be just enough for them to pass out of the university in 2022, 23, 24, 25. It should stand them in good stead by 2050. And how do you prepare students for that? When will we have the first course on AI and medicine? I was talking to one of my friends in the UK. He was saying some of the universities are considering removing biology from the entry requirement of medicine and make it across the board, whether the student come from social science background, mathematics background, or biology. Because in future, they think biology would probably be the less important part of the medicine. So brace for the wave of the fourth industrial revolution and AI and read more and more about it. I would be speaking and writing more about this topic once the COVID wave ebbs, but till then, please do your own homework. But now I will go to something which has been with us for some time, which is climate change. For the last 2 years, the world has more or less forgotten climate change, certainly since March 2020. We have all been very busy thinking about COVID. But the climate change has not gone away. Climate change is here. We have been talking about this since 1990. The 1990s, when I started working in this domain, the world was skeptical. They were asking, is climate change for real? And the scientists started to answer that question. The most elaborate scientific network ever created by human beings was created to tackle climate change, the Intergovernmental Panel on Climate Change. This is composed of more than 2,000 scientists selected by countries, all the 193 member states of the United Nations. And they were asked this question, is climate change for real? And they answered in the 1992 first assessment report of IPCC that the climate is indeed changing. So the second question which was put to them is whether man has anything to do with it, whether human beings have anything to do with that climate change. Okay, agreed, climate is changing. Is it because we are doing something? And they came out with unequivocal statement. Yes, human beings, there's a discernible human footprint in it. This is what the IPCC report said. And then followed the 1992 Rio conference, where the UN Framework Convention on Climate Change came out. Time moved on, and the skeptics started asking, okay, the climate is changing. Okay, human beings have something to do with it. But can we do something about it? Isn't it a geological process? Isn't it so big that we cannot do anything about it? And the IPCC came back and said, no, the human beings can do something about it. And thus came the 1997 Kyoto Protocol on climate change, where it was decided that the developed countries would start to reduce their carbon emission to pre-1990 levels. And there are many other conditions attached to it. But the skeptics kept on asking more and more questions, in a way to delay the actions which were needed. But by 2015, it became so obvious that the climate is changing, that all the signals were there. You are having more floods than ever. You're having more storms than ever. You're having storms which are bigger than ever. The hottest year on record was happening year after year, and records are being beaten year after year. So the world came to Paris with a more or less realization that yes, the climate is now changing, and human beings are responsible, and human beings can do something about it. But by then, the climate was started to change so rapidly that the question became as to how much of this climate change we can now control. Because there is a cost to controlling climate change. If you were to assume that climate will not do anything, by 2100, we would be looking at a temperature rise of more than 4.5 degrees centigrade. And the human civilization will not be able to adapt to that type of change. And that will be a doomsday. But if we act collectively, we still retain the capacity to restrain the climate change within 1.5 degrees rise. And that is the temperature rise by 2100 that the humanity will be able to adapt without major difficulties. But if we do reasonable effort, we can still achieve 2-degree reduction. But it will cause impact, but again, humanity may be able to adapt. So these are the parameters within which the humanity is now operating, that our aspirational level is 1.5 degrees centigrade. The likely level we are targeting is 2 degrees. But if you don't act, it goes beyond 4.5. And that's the worst case scenario which we are currently planning. In Kerala, in 2017, I was invited by the Kerala state government, the State Institute of Climate Change, to deliver a lecture on climate change to the assembly. It was in August 2017. And I was then actually very skeptical as to whether it will be very successful, because 1 year before, I was invited by the Kerala Disaster Management Institute. It's called the Institute of Land and Disaster Management, to deliver a lecture to a number of municipal chairpersons and mayors on climate change. And I went to Trivandrum, driving all the way from Kochi to Trivandrum. And there were hardly 25 people in the room, and there was not even one person who was a municipal chairman or mayor. They had all deputed somebody to attend the task, because people did not take climate change seriously at all. If it was some on municipal solid waste management, it was on revenue sharing, I can imagine people would have come. But climate change, who would come? So when I was asked to go to the assembly, I said, if at least 15 MLAs don't turn up, I will not start the session. On this condition, I went. But luckily, the chief minister came, the speaker came, half of the cabinet was there, and 80 members of the legislative assembly came to the session. And I explained to them that the climate change is for real. It's not real, it's not somebody's problem. It's not the problem in the United States, it's not the problem of the Arctic. It's a problem in Kerala. And we are going to see impact in every domain. So I said, you will see more peacocks in places where you never saw a peacock, for example. You will see more hurricanes or cyclones, as it goes, in Kerala. And I said, we will see a flood, the biggest flood we have seen, we will be seeing. That was 2017, August. Of course, there are a lot of questions. And the chief minister sat for 3 hours listening to this, all the MLAs. Unfortunately, of course, the climate change response cannot be that fast, but within 4 months, we actually had Oki, and within a year, we had the floods. And that's when it really hit the society in Kerala that climate is changing and is for real. Now, how is climate change going to impact health is the topic which you are probably interested in today. So I'll speak about it. And there are 5 separate reports which I am referring my talk on. And I'll be sending a note on this, and you will have links to each of this report. The first one is the report of the Intergovernmental Panel on Climate Change, IPCC report on climate change. And it has a chapter on health, how health is linked to climate change. Then there is the response of the World Health Organization on health and climate change. There is a specific section on the WHO website. There is a specific call for action and partnership and so on. There's a very interesting and very thorough study from the United States on the United States response to climate change and health. I have also got links of that. There's a Government of India report on climate change response, and health is a part of that. And I have also got copies of that. And finally, the state of Kerala has a state action plan on climate change. And if you Google for that, and if you look at the state action plan on climate change, there are many images, and right in the middle of that image is a mosquito. And so the heart of that, they have put, symbolically at least, health element in it. So what are the ways in which climate change is linked to health? And this we can start at what are the manifestations of climate change. Number one, as we all know, climate change is about global warming. The temperature is going to rise. It's number one. Number two is that the precipitation is going to change. In some cases, the total amount of precipitation would reduce, but that's not the main problem. The main problem is the intensity of rainfall is going to increase. And this, the IPCC says with very high confidence. Whether the total rainfall will increase or decrease, the IPCC has less confidence. But the fact that the intensity will increase, the IPCC has very high confidence. And it has already been noted across the world. So if Kerala is receiving 3,000 millimeters of rain, we will receive that in less amount of time, which means we'll have more floods on one side, but also more droughts on the other side, because the duration between rainfall events would increase. So the change in intensity of rainfall is going to increase both the floods as well as droughts. So that's the second impact. The third impact, which we should anticipate, is the rising sea level. So that's something which will happen slowly, but will change the situation, at least in the low-lying area, coastal areas. In Kerala in particular, Alleppey, Ernakulam is going to be highly vulnerable to the changing sea level rise. And finally, the change in the number and frequency, the number and the intensity of extreme events, such as cyclones, such as storm surges, such as floods. So these are the four clear hazards which start with climate change. Temperature will rise, sea level will rise, there will be more floods and droughts, and there will be more cyclones and other extreme events. 80% of the disasters which we handle at the United Nations these days are somehow linked to climate change, hydrometeorological, drought, forest fires, cyclones, hurricanes. So these are the four indicators through which climate change is going to reach us. Now, how will that turn into an impact on us is the question. How will a rising temperature affect health? The obvious impact is high temperature could cause heat stress in people. When I first went to Kanpur in 1986, heat stress was not something which I ever heard of in Kerala. And I don't think we had a word, Suryaghadam or sunstroke was discussed in Kerala. But now it is. At that time, when we were in North India, we were taught particularly that people from Kerala should be very concerned because you are not used to it. You may think it's normal because sunstroke don't happen dramatically. Like, you do not understand that you are getting dehydrated till the time it's too late. But this was not something which people in Kerala knew at that point of time. So clearly the direct impact of sun on people. And in some parts, in Kerala, of course, it manifests more as sunstroke, which is already happening. But in other places, it will also manifest as cancerous situation because of the intensity is increased. Then you have the issues of mosquito breeding. So you will actually see not only more trouble with mosquitoes, but places which never had mosquitoes will suddenly have mosquitoes. In Kerala, of course, in the high ranges, which did not have mosquitoes in the past, can already start to see them. You can also see countries, the Western countries, are now gearing up for mosquito and associated health impact. The World Health Organization estimates that up to 90,000 people, extra people, could die because of climate-induced vector-borne diseases. There's also the whole problem during both floods as well as drought about the availability of clean drinking water. When you have shortage of water, clearly people will drink whatever water is available to them. And when there is floods, as we have seen in Kerala, all our existing water supply systems will be contaminated with everything else. In Kerala, already, because of the prevalence of septic tanks and lack of proper sewage treatment facility, 80% of our drinking water wells are contaminated with E. coli. We already know it. But we saw during the floods that all the dirty water, all the dead bodies of cows and other things were floating all around the place and was landing in your water supply. So during both drought and flood, you will have problem with drinking water. You also have problem of massive mosquito breeding in the coastal low-lying area due to sea level rise. Because places which normally did not have waterlogging will start to see that waterlogging. If there are people from Ernakulam in this group, they will know that in many parts of the heart of Ernakulam, year after year, they are finding it difficult that water is encroaching into their house. I know a number of houses in the heart of Ernakulam, very close to MG Road, where the floor of the houses is being filled with the concrete, because, just to avoid the water from reaching into their bedrooms more and more. But this water, which is logged all around them, is going to breed more mosquitoes and create more disease. So it's not only the temperature, but also the waterlogging, which is going to increase the amount of vectors. You also have the issue of migration of people, that they are living in areas where there is climate which is changing, and their livelihoods are affected, and they have no way but to go. Kerala, as you know now, is the Gulf of many other states in India. There's an institute in Perumbavoor, it's called the Center for Migration and Inclusive Development. They study migration into Kerala. The Center for Development Studies study the migration from Kerala to outside India. The CMID studies migration into Kerala. And they have mapped where are these migrants coming from. And there is almost an identical matching of the districts which are drought affected, which are flood affected, which are cyclone affected, and the places from where migrants are coming to Kerala. So clearly, and this is just within Kerala, this is also happening from Syria to Europe, from Libya to Europe, from Mali to Europe. So that is also happening across the world. And when migrants move, so does all the health issues associated with them. Migrants are the most vulnerable of the lot. So the climate change is increasing their vulnerability, increasing vulnerability of a lot of people. So there are many ways in which health and climate change are linked. Now, add to this mix the change which is going to happen in the agricultural pattern, that you are not able to produce enough food. You don't have enough income to buy food. So you have an issue with the nutrition of people, and especially of children, especially of migrants. And you mix all this up, suddenly you have more people who are ill, more people who are vulnerable to illness, and you have more illness. And the end point, the WHO estimate that up to 290,000 people per year could die because of climate-induced diseases. And this is not a mean number. So obviously there are enough reasons why we should be looking at climate change. But health is one extra reason. There's one more thing which people do not consider. I was looking at these various reports, but something which people do not consider when we talk about climate change and health. This is about health infrastructure. What happens to health infrastructure when the climate change? When you have floods or hurricanes or cyclones, hospitals get affected like any other building. Water gets flooded into the generator room. And this has happened during the 2019 flood. So hospital, which should be the heart of the healthcare to protect people after disaster, is no longer available. So it is time that we looked at each of our healthcare facilities. Every hospital in Kerala should be looked for their climate vulnerability. In case, what will happen to the Ernakulam General Hospital if something equivalent to a cyclone Oki come past Kochi? And I'm sure it will come. Those of you who know me actually know that when I predict something, it happens, unfortunately. Many of our critical infrastructure in hospitals is actually on the coastline. And our entire health system is hinged upon it. So dealing with that is absolutely essential. I will just talk about a few more environmental determinants of health, and I will stop and I'll ask if there are questions. Vice Chancellor already mentioned about how diseases are jumping from animals to humans. And the closer you go into animals, which you do not normally go, the greater is the chance that a disease will jump from the animal kingdom to human. So as we destroy environment, as we cause more deforestation, as we get more and closer to the wildlife, more wild things will start to jump. I think it was a PVC who said you ought to have 30 zeros after 1 to decide the number of microbes. I don't know if it's VC or PVC. But clearly, if we had seen Nipah, if we had seen COVID, Corona, there are a lot more out there ready to pounce on humanity. The closer we go, the bigger danger we are in. So clearly, there's an environmental link to the disasters. It is estimated that 70% of new virus diseases which are coming are zoonotic. So the safer we keep our ecosystems, the safer we are. And that's where the whole idea of One Health come in. The linkages between air pollution and health is not particularly visible or obvious in Kerala, because by and large, our air pollution is good, even in our cities. Of course, we do have our own problem, but nothing compared to the scale of major cities. But you go to Delhi, people are choosing to leave Delhi. As an international audience who want to come to work to Delhi, the first concern there is air quality, especially during the winter. Air quality is so bad that children suffer, that adults who have asthma suffer. In any case, everybody suffers. Air pollution is now one of the biggest killers of people. It doesn't kill dramatically, such as inhaling hydrogen sulfide or carbon monoxide, but it does reduce the number of years you would have lived. It does reduce the quality of life for everyone who would probably live longer. So air pollution is one of those big environmental health issues. Water pollution, other than that caused by drought or flood, but from industrial sources, from lack of sanitation, is a huge environmental factor which is linking health. Some of you who actually follow the medicine, the history of medicine, would actually know that if you look at one chemical which saved more life of human beings than any other chemical, it is not a medicine, it is not an antibiotic, it's actually chlorine, which was used to treat drinking water. The moment chlorine was identified for its potential use to disinfect drinking water, millions of lives started to be saved even now. So clean drinking water is one of those really fundamental environmental issues which has linkages to health. Those of you who follow me on my Facebook would have read 2 days back, I wrote about asbestos. Asbestos is a material which is there across Kerala. Some of your medical colleges probably have wards with asbestos roof in it. In 1997, my father died of a rare form of cancer called mesothelioma. I did not know anything about that disease till that time. My father died a very, very painful death. But he died very quick. That's the only blessing we had. And I went back and started researching what is this. And it was told it is exclusively coming out of asbestos. And where did my father get exposed to asbestos? We never had an asbestos roof in our house. He was working in a factory. So I went back to the factory and checked where he could have got exposed. And of course, he worked in a factory in 1940s. So there was no linkage with that factory. There was no evidence of that factory. But much later in life, I would figure out how asbestos is not used just as a roofing material, but in over 1,000 forms. Asbestos is all around us. And in factories, it's as refractory material, as for protecting against heat, all sort of usages are there, as wall material, as sprayed, as pipes for drinking water. Asbestos is all around us. And still, asbestos is being used. And you could get thousands of deaths coming out of asbestos. I don't know in Kerala, but around the world, asbestos is considered one of the big killers of people, one of the biggest occupational health hazards. And because of that, asbestos was banned over 3 decades back. And when a factory is found to have asbestos, that factory then become almost nobody would buy that factory because the exposure of asbestos, which would have happened over a period of last 30 or 40 years, and the financial ruin because of the compensation claims which could come is so high that nobody would buy it. In Switzerland, when you have to renovate a building which contains asbestos, it could cost 5 times as much if you renovate a normal building. Yet, I was told when I wrote my post in Kerala, the other day they were auctioning asbestos sheet which came out of a building because asbestos is still being used and cut into pieces and fixed into locations, causing death of people and continue to do so. Clearly, and I will conclude by this saying that there are also invisible killers, such as radiation. Radiation sources, both natural and man-made, are all around us. What happened in Fukushima, what happened in Chernobyl, but also what's happening in our own facilities where there may be radiation sources which could expose people to environmentally induced radiation, which could then lead to health issues, which could then cause death 30, 40 years hence, and people, nobody will make the link. I would conclude at this point. I want to once again congratulate the doctors and the young students for the tremendous work which they have done on the face of COVID. I wish you all a good World Health Day, building a fairer world for all, and I'll take questions if there are any. Thank you.
Participants, thank you, sir, for your extremely interesting presentation about you have very clearly explained all the impacts that is happening due to the climate changes. You have very clearly said about a briefing about the artificial intelligence revolution and the impact of climate change. And we have all gone through the disastrous field of the flood. It was very interesting, and it was very, we are really honored to have you here over here, sir. Now, the participants, if you have any questions to be taken, you can just raise your hands and can directly interact with our sir, or you can even post your questions in the chat box.
may I ask a question?
Yes, please.
Okay. So most of you, thank you for taking us. It was an excellent journey from global to local. Most of these possible interventions are at the policy level, protocols, Kyoto or Paris, US, Trump's position, so many other. But coming to local actions that can be initiated at the academic level, because at the initially our Vice Chancellor Mohan sir also mentioned about universities' roles. What do you think are the potential action areas where a university can work at the academic level in the Kerala context, specifically in the Kerala context? As you mentioned, the mosquitoes picture is there in the Kerala document because dengue was quite a big problem for us. And it's happening globally. So many of these, Nipah you mentioned, and many of the even local government or state government level, many policy and legal frameworks, land utilization, how much of forest areas, how much of hilly areas, so many policy decisions. Apart from that, coming to the academic research or the medical health science part of it, what are the potential maybe 5 areas or so where we can actually work it?
Thank you. I am assuming you are referring specifically to climate change or environmental health. If you could just clarify that.
Both, sir, because both are related and relevant for us.
Sure.
For Kerala, I think both are relevant.
Thank you. Okay. I would start by saying that a course on climate change and its linkages to health should be mandatory for all health students, regardless of whether it is medicine, nursing, dentistry, whatever. That we should know that the climate is changing, and we should know that we can do something about it. And within that, there are ways in which we can do a footprint of ourselves as to what is that we are contributing to climate change. So there are, human footprint, climate change, carbon footprint calculators. When I actually had the lesson in the assembly, actually I shared with them, and I'm very happy to share it with you as well, as to what are the things which we do which would make a difference. For example, what difference it makes if we come by a car to the college as a student, or in this college bus, for example, how much? And in our case, we are often asked, what difference if you fly versus train, or if you fly business class, and so on. So there is that personal responsibility element in it. The second point, as an institution, you can actually do a carbon audit of your institution and see how much of a carbon footprint you are having and what are the ways in which you can change it. For example, are you using the most energy efficient technologies? Do you have a biogas plant? Is it something which is possible? So that's the second part you can do. The third part you must do is all about the personal safety element. When you recall that when the Nipah came, there's not even enough availability of personal protective kits in Kerala. The whole idea of PPEs and the use of PPEs, it all evolved during Nipah, which is a very good thing that it happened at least then. But even now, if you look at how we handle the entire health and safety of the medical workers and the staff, we are nowhere near international best standards. So clearly that's something where if you do not have already a specific course on it, it should be done. And my recommendation is that the possibilities of the new technology of online learning can be used here. So you don't need a professor in every college and every dental college and every nursing college to teach it. You can have one super teacher make these lessons and make it mandatory that you should complete this within the first 6 months of your academic year. This is exactly how we are trained. When we are trained to work in the UN, we have a number of courses where we do physically. But we also have a number of courses, up to 10, which are absolutely mandatory, which we must complete within a given point of time. And I think this is something which you must do in your institution. As I mentioned, the whole idea of occupational health is totally underappreciated. It's almost like public health till COVID came. When COVID came, public health became the most important element of our health system. That we knew that public health prevent more deaths than all our ICUs combined multiplied by 100. So as much as we have now started to appreciate public health, we must now start to appreciate occupational health, because there are many environmental factors which are leading into occupational illness and killing people in a very bad way without them even knowing it. I was giving this example of people who are working in petrol stations. In Europe, there is no petrol station attendant. Every passenger, every driver who drives a vehicle, so stop the car or his vehicle or her vehicle at the petrol bunk, and they have to fill petrol or diesel themselves. This is not to save money. This is to ensure that people are not exposed to vapors of hydrocarbons for 8 hours continuously. When you have one individual filling petrol for everyone, and in Kerala, they often work for 12 hours. If you were to conduct a study of every person who worked in our petrol stations for the last 50 years, I can bet you that you will pick up a very statistically significant number of specific diseases, including cancer. But they don't even know. They're all dying in different places, never connecting their work to their. So occupational health improving is absolutely critical. My final point is about advocacy. As much as you are doing things inside the college, as much as you are protecting yourself, universities should now use the power of technology by which we can project your knowledge out into the world. People are all doing webinars like this, but we can reach not 100 people, not 1,000 people. Even in this webinar, if the Kerala Health University have, let's say, 40,000 students, we should be able to get 40,000 students to listen to this, because only then we achieve scale. Reaching 100, 200 is good, but if you have to improve our environmental health, the message has to go to all the 3.3 crore people in the state. And to do that, we now have the power of technology. Thank you.
Can I ask a question?
Yes, please, Doctor.
Dr. Muralee, I am Justice Hariharan Nair, Chairman of the University Ethics Committee.
We met.
Also, you remember me?
Yeah, we met at Ernakulam during the opening of the...
And also at the Kerala International Center, Trivandrum.
At the KVASU Trivandrum, yes.
Now, my question is, we hear a lot about the possible impact of 5G coming into our frame.
Yes.
Some studies indicate that it's going to create havocs and untold misery for the people. Have you come across any such study about the impact of 5G?
Thank you. We ever since this all microwave towers started coming up around the world, there has been concern on their health. And there are a number of studies which has happened and is happening. But till now, there is no settled position on this one. And the balance of evidence still prove that there is no major impact on human health. So across the world, I don't know any country where they have actually banned this. There are systems to monitor, etc. There are continuously studies happening, but there is no, as I said, there is no scientific settled position that it has a major impact. to the degree that I am aware of. Thank you. Hope you are doing well, sir.
Fine. Thank you, sir. Thank you.
Okay.
So we have few questions in the chat box. Can I ask you, sir? So we have few questions in the chat box.
Yes, I'm looking at them.
Sir, how peacocks are related to climate change?
Yeah. So, and I mentioned peacocks. There's a very interesting write-up on this. There are research papers. I'll be happy to share. It actually came from your Mannuthy college itself. But the point I was making is that there are habitat changes happening. So, peacocks will come to a certain area if it is a suitable place for it to live. And peacocks used to be in a normally prefer dry areas. So if you see more peacocks coming into your garden, which it never used to, then you should assume that your garden is getting more habitable for peacock. And this is increasingly happening across Kerala. So in the past, we had peacocks, in Palakkad and its surroundings, but now you are seeing more and more of that in Thrissur and surroundings, and even Wayanad I saw, which actually means that more area is getting dry, and this is one of those early bioindicators of habitat change. And there are, if you Google it, you'll get the information, but I'm also very happy to share the research papers. I myself had to read and convince myself that this is happening. Thank you.
Thank you, sir. We have one question. Don't we have a legislation to participate people like mayor or MLA in meetings like global warming?
Now there is no legislation to participate anybody in anything, so, and these are not issues to be legislated either. These are things which people, and now I'll give you another example. It's not just about mayor. I once suggested to the Kerala Institute of Land and Disaster Management and the Kerala Press Academy that there should be a training for our media people on media and disaster management, because I see many wrong practices in reporting disasters. And we arranged, accommodation for them. We arranged training program. We have, we got people from Delhi. We got international experts. And the day came, there are nobody who came, and eventually we had to go and sort of, beg the local press club to send some of their students to participate, so that when the MLA came to inaugurate, there were some people in the room. I think this was in 2017 or 2016. And 2 years later, after flood, I was asked to give a lecture on the same topic, and the room was full, absolutely full. Because once the disaster hit you, people get the idea. So I know if I were to go now and propose that we can do a seminar on climate change and coastal cities, every mayor and every municipal chairman and chairwoman would now come, because now they know it's real. But before that, it was somebody else's problem. It was a flood was something which happened in, I don't know, North India, Ganges, and cyclone something happened in Andhra Pradesh, but not us. But that complacency is now gone. Thank you.
Thank you, sir. So the next question is, how can we bring more awareness among school level children? Do you think there is a need for curriculum redesigning by considering these facts?
Thank you. I would take this as my last question, because there are other speakers and I shouldn't be taking their time. And absolutely, it should be going into our school curriculum. The problem is that what will come out of the school curriculum? Everything is going into the school curriculum. The gender is going to school curriculum. Drugs are going to school curriculum. Safety is going to school curriculum. So as much as we put things in, we should also be able to take things out of the school curriculum. And this is where we are not very good at. So we are burdening our children with more and more useless things, as much as we are bringing in new things, and teachers are tired. So I agree that life skills such as swimming such as, learning to do a bicycle should be in the curriculum, and lot of, useless thing as whether Akbar planted trees or, dug wells should be out of the curriculum, but there has to be a thought through decision on this. And school children should have more enjoyable schooling, learning more life skills, and certainly be more aware of future. Thank you all.
Thank you, Dr. Muralee Thummarukudy, for your wonderful talk. And I would like to invite you to the university when you come back to Kerala as soon as possible. And also your suggestion to start a course on climate change, definitely we will take it up. We need your help in that, because now we are creating courses in the Moodle platform in a massive open online course. We are creating courses so that we will give it as a add-on course to all our students. And this talk and this program, definitely we will be hosting YouTube, so that maybe a large number of students, we have 1 lakh students for that matter, they will be able to see. Thank you. And we will be in touch in future also. Thank you. Thank you so much.
Thank you.
Thank you, Muralee sir. And I also would like to invite you to our Kerala Veterinary and Animal Sciences University. The headquarters is at Pukkod, a very beautiful place.
Certainly I will come. Certainly I will come.
Okay, sir. Thank you.
Thank you, sir.
Thank you.
Now I'll introduce the next speaker, eminent speaker of today's session. I'm overwhelmed to introduce our next eminent speaker, Dr. Latha. Dr. Latha, ma'am, is the Faculty Dean of Kerala Veterinary and Animal Sciences University and is a professor and head of Department of Veterinary Public Health. Ma'am has 27 years of experience and has completed 45 research projects funded by many funding agencies like ICAR, KSCSTE, and Kerala State Plan. She has published over 110 research articles in reputed national and international scientific journals, 3 books, and has presented more than 175 papers in several national as well as international seminars and symposium. Ma'am is a recipient of several awards like GP Sen Endowment Award in 2001, PG Nair Endowment Best Teacher Award in 2009, Fellow of Indian Association of Veterinary Public Specialists in 2014, and Best Poster Presentation Awards in 2010, and from 2012 to continuously till 2020 in Kerala Science Congress and Kerala Veterinary Science Congress. Ma'am's special field of interest includes research on zoonotic diseases and quality control in food production system. Her leadership, persuasiveness, and initiative are exhibited by the yearly conduct of World Zoonoses Day program with the awareness campaign on No Zoonoses to No Zoonoses. Madam was instrumental in establishing NABL accredited quality control laboratory for water testing in Department of Veterinary Public Health, catering the need of the public in evaluating drinking water quality. With this brief introduction, I extend my hearty welcome to Dr. Latha ma'am to deliver your talk. Ma'am, please.
Hello, am I audible?
Yes, ma'am, you're audible, ma'am. Yes.
Thank you, Dr. Santhya.
Thank you, ma'am. Welcome, ma'am.
The respected Vice Chancellor of Kerala University of Health Science, Dr. Mohan Kundumal, and all other dignitaries, including the Pro Vice Chancellor, Registrar, Controller of Examination, and other dignitaries, staff and students, and my dear participants. Good afternoon to you all. First of all, let me congratulate the organizers for celebrating this auspicious day, the World Health Day, in a grand manner. So without much delay, I would like to go into the paper. So you can see that, Santhya, ma'am?
Yes, ma'am. Everything is very clear, ma'am. Perfect.
Okay. Sound is also clear.
Yes,
right?
yes, ma'am.
Okay, so let me start with the paper. My paper is One Health and Control of Zoonoses, a veterinary perspective. So we know this is just to refresh your memory. we know what is zoonosis, the diseases and the infections that are naturally transmitted between vertebrate animals and humans. And this has been derived from two words. Zoon means animal and nosis means diseases. And in this particular definition, the naturally transmitted, this is very, very important, without which I never used to give marks to the students. So only the diseases which are naturally transmitted are considered as zoonosis. And now these are certain data, 14, 15 pathogenic organisms, infectious agents are affecting humans, of which more than 61% are considered under the term zoonosis. And there are so many emerging and re-emerging zoonoses now, about 175, of which 75% are zoonotic. These are the different agents responsible for causing various diseases. Now, there are so many different types of classification of zoonosis, of which this is the most important one. That's why I have included this. This is based on the reservoir host. So, the diseases can be classified under three headings. First is the anthropozoonosis, where the primary reservoir host is animal, and from the animal, the disease gets transmitted to man. Most of the zoonotic diseases comes under this particular group, including your anthrax, your brucellosis, your plague, and all. And the second group is the zooanthroponosis, where the primary reservoir host is man, and from man the disease gets transmitted to animal. And the examples are comparatively less, like your human tuberculosis caused by Mycobacterium tuberculosis and Corynebacterium diphtheria caused by Corynebacterium diphtheriae. And the third group is the amphicyanosis, where both man and animals can act as the primary reservoir host. That means in both directions, the disease gets transmitted. And now there are so many, I told you, there are so many emerging diseases and re-emerging diseases, and there are so many factors responsible for the occurrence of zoonosis as well as for the emergence and for the re-emergence. I will just go through the important factors before going into the One Health proper. So there is one term, spillover. That means the infectious agents gets transmitted from the domesticated group to the wildlife, that is the spillover, and the other term is the spillback. Spillback means that is from the domesticated, from the wildlife to the domesticated animals, that is the spillback. And you can see these are the diseases which can be shared between human and the wildlife: the Lyme disease, the monkeypox, the hantavirus, Ebola, and SARS and all. And there are diseases which are shared between human and the domesticated animals, including your BSE, that is the mad cow disease, Escherichia coli, cowpox, and Rift Valley fever. And these are the groups of diseases which are shared between human, wildlife, and the domesticated group, that include the rabies, West Nile virus, tuberculosis, anthrax, and all. And there are so many different factors. First, the one is the overcrowding and the rapid population growth, the exponential increase in the number, and 1.6 billion in 1900, that was the world population, human population. Now it reaches to about 7.8 billion. So you can think of, and this is the human animal interaction, the close interaction between man and animals. And in most of the cases now, people even prefer to have animals than the children. That much interaction is there between man and animals. And there is advancement of transportation. So you can see this around the world. If you want to travel, it was taking 80 days in 1922, and it is now just 8 hours. That is the data in 2016, and it is increasing, means the facilities are increasing day by day. That means once you get an infectious agent into your body, before completing the incubation period, you may be reaching the other part of the world. That much transportation facilities had increased, and that is one of the important reasons for the occurrence of very many diseases. This is another factor: import and export of animals, their products and byproducts. Legally, the certificate, with certification and all, transportation occurs, and illegal transportation also occurs very commonly, and that is another important factor. And this is changes in the genetic makeup of the pathogen. When we heard about this bird flu, that time we heard much more about the antigen antigenic drift, antigenic shift, those are responsible for the occurrence of the new pandemic strain of the influenza virus. So that is another important factor. And the AMR, now people are much concerned about the antimicrobial resistance, the much hue and cry about the antimicrobial resistance, and that is another important reason. And the bioterrorism. Infectious agents are used as a chosen weapon for the bioterrorism. The best example is your anthrax, then there is plague, then tularemia, like that. Lot many organisms can be used as a chosen weapon for the biological disaster or biological war. And the ecological changes, as our Murali sir rightly pointed out, the climate change that is responsible for very many problems, including the occurrence of different types of diseases, especially the vector-borne diseases, and the unplanned and underplanned urbanization. People are moving towards the cities, and it is overcrowding is there in those urbans and all, and poor sanitation. You can see the situation of our water bodies. So how it is contaminated, how it is unhygienically maintained, and that is another important reason. Then inadequate public health infrastructure, we have to improve a lot of improvement is taking place, and we have to improve a lot. And the deforestation, people are intruding into the forest, and that is responsible for the occurrence of different types of diseases. The best example is the Kaisanur forest disease. Kaisanur forest disease is occurring nowadays, especially in Wayanad area, and all it is occurring. And that one of the important reason is intrusion into the forest. Then channeling of funds to the other problems, that is another. So because of all these things, the diseases are showing. So you can see the increasing occurrence of the diseases. So these are the diseases which shows the upward trend. Our COVID-19, Zika is considered as the cousin of your dengue virus, because it is the same vector is involved. That's Aedes aegypti. Then Ebola disease, MERS, it is considered as the cousin of SARS. Then swine flu, avian flu, West Nile fever, Nipah, KFD, this BSE bovine spongiform encephalopathy, then E. coli O157H7, which is the emerging pathogen, Marburg virus, cholera, Rift Valley fever, hantavirus, dengue. The list is on and on. And we have certain diseases which are showing downward trend, including the smallpox. Luckily, it is eradicated, and guinea-worm disease, poliomyelitis, measles, leprosy, neonatal tetanus, these are all showing the downward trend. But leprosy, now the cases are there, and it is increasing. So this is the very latest latest article that has published in the Transboundary and Emerging Diseases 2 weeks to 1 week before. This is the latest article from the University of Sydney by this Singh, Ward, and Navneet Dhand, and they have identified the factors that may predict the next pandemic. That means they have used the epidemiological modeling to predict, to find out the drivers of various infectious diseases, and they have categorized into three: the zoonotic diseases, the emerging diseases, and the human diseases. And they have seen that the zoonotic diseases, the major drivers or the major factors are the land area, the human population density, and area of forest. And areas with high zoonotic disease diversity include Europe, North America, Latin America, Australia, and China. And about the emerging diseases, the major drivers are the land area, human population density, and the human development index. And the areas with high emerging disease diversity include Europe, North America, Latin America, and India. The human diseases: higher per capita health expenditure, mean animal temperature, land area, human population density, human development index, and rainfall are the factors responsible. And the areas with high human disease diversity include the North America, Latin America, China, and India. So India finds place in both these emerging diseases and the human diseases. And the situation is really alarming. We have to be careful. Now, coming to the topic proper, One Health, the zoonotic prioritization in One Health. One Health approach plays a significant role in the prevention and control of zoonosis. So we have seen the emerging and re-emerging zoonosis evolved in last 3 decades, partially as a consequence of interdependence of humans and animals and their products, and also due to the close association with companion animals. And the zoonoses are considered as the single most critical risk factor to the human health and well-being. So, what is meant by the term One Health? You're all aware, but just the proper definition is this: One Health. It is a collaborative, multi-sectoral, multidisciplinary approach working at the local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animal, plants, and their shared environment. So it is a collective approach, and these are the disciplines comes under the One Health, including the veterinary medicine, the human medicine, molecular and microbiology, ecology, health economics, environmental chemistry, public health, and all the other related disciplines. And first start with individual health. It can lead to population health and the ecosystem health. So these are all the areas comes under the One Health, all the infectious agents, bacterial, viral, and then antimicrobial resistance, food safety, global health, all this comes under the area of concern under the One Health, comparative medicine, transitional medicine, cancer, then human animal bond, all this comes under the One Health. So about the history, I'm not going into detail of the history, but just this one, that is Rudolf Virchow, the father of comparative medicine and cellular pathology, who had coined the term zoonosis. His father was a butcher, and Virchow conducted works on cysticercosis, bovine tuberculosis, and life cycle of Trichinella spiralis. And the important thing he had pointed out is between animal and human medicine, there is no dividing line, nor should there be. The object is different, but the experience obtained constitutes the basis for all medicine. So this is the basis for the One Health, One Medicine concept. The foundation of One Health include the people who protect human, animal, and the environmental health and other partners. By coordinating, by communicating, and by collaborating, you can achieve the best health outcomes for the people, animals, plants, and our environment. So that is the concept of the One Health. Why we need One Health? Because animal, human, and environmental health are fundamentally linked. Because we have seen already the zoonosis affects more than 2 billion people, and it causes mortality among 2 million deaths. Mortality occurs per year. And you can see the severe havoc happened. That is the Spanish flu and the HIV alone have taken hundreds of millions of lives over the past century. Severe pandemic costing 3 trillion US dollars may occur on an average once in 100 years. So that is the projection. So if you go for the One Health approach for the control of these diseases, you can save the amount up to 30 billion US dollars per year. So that is the benefit, that is the beauty of One Health approach for the control of zoonosis. And this is the recent report. This was given in the recent report by the World Bank. And the benefits of One Health: improve animal and human health by interdisciplinary collaboration, meet new global challenges, develop new centers of excellence for the education and training in specific areas, increase professional opportunities, and gain scientific knowledge to create innovative programs to improve health. So how to reach One Health? So for that, these are the important steps. First one is consensus among the stakeholders. You have to go for consensus among the stakeholders, then collaboration among the professionals, cooperation among the interdisciplinary groups, coordination among the partner agencies, and the commitment between the partners, the regional organizations, and the national government. So what about the One Health status in India? We are just in the embryonic stage. We have to move far. We have so many things we have to do. That means we are just in the beginning stage, and increasingly the One Health approach is gaining importance. Government of India has taken initiative, but several challenges at the level of implementation. So the background of One Health approach in India. So this we have seen already the zoonotic diseases are appearing, mainly the avian flu, rabies, tuberculosis, and are all the increasing trend. The emerging zoonotic diseases are the, and especially there are diseases transmitted from wild animals, wild to the domestic, and One Health approach should look into the wild animal zoonotic disease outbreaks also. The development in One Health approach in India. So we are taking this national standing committee on zoonoses by the government of India recommend policies, operational research, and intersectoral collaboration with the National Center for Communicable Diseases, the Indian Council of Medical Research, Indian Council of Agriculture Research, then the Department of Animal Husbandry, Dairying and Fisheries, outreach program on zoonoses led by the Indian Veterinary Research Institute, IVRI, Nagar, then World Health Organization, and roadmap to control the zoonotic diseases, to combat the zoonoses in India. So ICMR, ICAR collaboration exists for the control of zoonoses, as well as it acts as a platform for the One Health partnership. So all these centers aims at capacity building for surveillance, response, and advocate the health promotion. And we have the One Health Center under the Kerala Veterinary and Animal Sciences University. It is the only one that is not there in most of the countries. And we have the One Health Center. And this is the emblem of One Health Center. It is located at Wayanad district, Pukod campus. And the motto of the cohort, this is what is called as cohort. Cohort motto is for harmony among man, animals, and nature. You can see man, animal, and nature, MAN. And the vision is to be a global center of excellence in One Health education, advocacy, research, and training. And the mission is to support in achieving sustainable health of man, animals, and its surrounding environment through leadership, partnership, research, and training in One Health domains. And we are conducting regularly various programs to educate the public as well as the school children and all under this cohort. So now, what is the role of veterinarian in the prevention and control of zoonosis? Veterinarians play a very important role because already we have seen most of the zoonotic diseases are anthropozoonosis. Anthropozoonosis. That means the zoonotic diseases transmitted from animals to man. Zoonotic diseases transmitted from animal to man. And when so the zooanthroponosis is comparatively less, and the lucky thing is that the man is considered as a dead-end host in most of the zoonotic diseases. So the diseases occurs first in animals and the wild settings before affecting and spreading in the human population. So veterinarians play a very important role in the control of zoonosis, in the prevention and control of zoonosis. So most of the zoonoses are preventable if cautionary measures are taken, and the veterinarians play a vital role. Again, another important thing is that once there is an infectious agent which affects the animal population, and if we are not in a position to control by other means, we can do the test and slaughter policy as we are doing it for the bird flu and the other important diseases like the Nipah virus and all. In the Nipah outbreak, which occurred in Malaysia, about 1.5 million animals were disposed. Like that, what happened now very recently, the bird flu outbreak, and we are doing the test and slaughter policy. So that is possible in case of veterinary practice, and that is one important thing. Protect your animals from disease and the contamination. And the prevention and control of zoonosis, when in all of my zoonosis class, always I used to tell the students, once you are thorough with the mode of transmission of the diseases, it's very easy to chalk out the control programs. So you have to be thorough with the mode of transmission of the diseases. So here the reservoirs or the animals or the humans. So this is the weakest linkage where you can do the prevention. Then this is the routes of transmission, and it is transmitted to the susceptible host, where another again the weakest linkage you can identify, and you can go for the immunization and all. The basic approach in controlling and preventing the disease is to identify the weaker linkages in the chain of their transmission. So the prevention and control first, the epidemiology of the disease is very, very important, and you should have sound knowledge on its magnitude, the spatial and the temporal distribution, multifactorial causation, source of the infection, and the dynamics of transmission. Only with that you can plan the methods for the prevention and control of the disease. So, what is prevention? That is to exclude a disease from the healthy population. That is the prevention, and it is the first line of defense against disease. And these are the different measures for the prevention: the quarantine, the immunization, the environmental hygiene and chemo prophylaxis, education of the public, then early diagnosis. And there are prevention, then control, then eradication. Control means to reduce the morbidity and mortality of the disease among the population, and eradication means it is the complete elimination of the disease from the population. That is eradication. And you can see the approaches employed for prevention and control of zoonoses. There are different sequential steps. So that is the quarantine, test and slaughter, environmental hygiene, mass immunization, vector control, reservoir control, early diagnosis and notification, treatment, genetic improvement, and health education. And for the control of foodborne diseases, you have to go for the good sanitation and hygiene during food production. So all the stages starting from the production till it reaches to the consumer, that means the farm to table concept, the farm to fork concept. And there should be proper meat inspection, the clean milk production, and follow the World Health Organization thumb rules for the control of foodborne infections. So the quarantine, we all know what is quarantine. It is the restriction placed upon the movement of animals, plants, man, and goods which are suspected of being carriers or vehicles of infections or having been exposed to the infectious agent. And the longest incubation period is taken as the period of quarantine for the infectious diseases. This is the test and slaughter policy, as I said earlier. If a disease is infectious, affecting animals, after animals can be a source of infection to others. And in such circumstances, it may be economically and technically expedient to slaughter an ill minority of animals to protect your healthy majority. That is very, very important. Slaughter the ill minority of animals to protect your healthy majority. And the environmental measures, plant water management, proper waste disposal. So as sir was telling, Murli sir was telling, 80% of our drinking water is contaminated. That's true. We are doing in our department. We have NABL accredited quality control laboratory for the testing and quality control of the water. And so that is in the Department of Veterinary Public Health, and we are finding the same result, no doubt in that. So we have to be very, very careful about the quality of the water that we drank. And then proper waste disposal, use of fly traps, source deduction, and the filling and drainage operation. The environmental control, we know this is the fogging, then mosquito nets to control the vectors. So you can go for different methods, and this water logging and such things should be avoided. And the immunization. Responsibility of farmers, veterinarians, and veterinary staff to minimize risk to the animals, farmers, and public, and provide highest standard of care to the animals. Animals with vaccines for there are so many diseases for against which the vaccines, and regularly the animals are vaccinated for that. And the ring vaccination, whenever there is an infectious agent in outbreak and all, you can go for ring vaccination from the epicenter up to 10 kilometers. You have to vaccinate the group. And the routine vaccination, okay, you can do the screening and you can go for the routine vaccination. So this is just the pictorial representation. Suppose an infectious agent is entering into an unvaccinated herd, this will be the situation. Everybody will be affected. And this is the case where the vaccinated herd, these black dots and all are the vaccinated herd. And once the infectious agent enters, it will affect the unvaccinated, and the vaccinated herd and animals will be safe. And so that is just pictorial representation. And about the vector-borne diseases, we know there are so many diseases, and there is a very close relation between the climate change and vector-borne diseases. And last 2 weeks before, I have taken a class on climate change and the vector-borne diseases. I think to the Amrita students. So this is very, very important. And the diseases spread by vectors kill 1 million people every year. And more than half of the world's population is at risk. We know the so many diseases like your dengue, like your Japanese encephalitis, like your Geisenhour forest disease. So many diseases are there which are vector borne. And for that, you have to go for vector control, an integrated approach for the vector control, the environmental management, source reduction. That means the destruction of the breeding places, chemical control, biological control, genetic control, personal protection, and health education. There are different methods, and the biological measures include the fish, the use of biological agents like the fish, the gambusia. Nowadays, during this COVID situation, most of the children, they are all very much interested with this aquarium, the fishes and all. So they are rearing this gambusia and the guppies and all, which is having a very important role in the control of vectors also. Then fungi, Coelomyces, then protozoa, Nosema algera, and Thelohania and Vorticella, and the bacteria, including the Wolbachia species of bacteria, Bacillus thuringiensis, Bacillus sphaericus. All these can be used as an agent for the biological control of the vectors, including the mosquitoes. And for the this reservoir control, reservoir is defined as any person, animal, or non-living thing in which infectious agent lives, multiplies, and can be transmitted to a susceptible host. So you have to go for the reservoir control. And the early diagnosis nowadays, because of the advancement in the technology, latest techniques are available for the diagnosis of various infectious agents, including the molecular techniques, and which will not take much time for the diagnosis, and you can go for the early diagnosis. And then the treatment, then this mass treatment of affected population may be carried out under an emergency, or when the disease prevalence is very high, you can go for the mass treatment, and then you can also try for the prophylactically the chemoprophylaxis. Then use of coccidiostat, that is example in the drinking water, which is the chemoprophylaxis. Like that, you can go for this. And another important thing is the genetic improvement. There are certain breeds which are resistant to various diseases. So like that, you can do the selective breeding. And for example, certain breeds of cattle in Tessie zone of Africa are known to be tolerant to trypanosomiasis. Like that, there are different breeds which are resistant to various diseases, and based on that, we can do the selective breeding. Then health education, that is very, very important. The education, the experience, and the training. Health education, educate the public and the school children and the farmers about the zoonotic diseases and the methods for the prevention and control. And also education and the training is very much essential for the educated people, for the practitioners in veterinary, medical, and wildlife domains need to be educated and trained continuously for having better understanding of the zoonoses, the emerging and re-emerging trends and factors associated with these conditions, and immediate detection of the zoonosis so that a quick response can be initiated. So health education plays a very important role in the control of zoonosis. So that is about in general. And now the foodborne diseases. We know the foodborne infections and the foodborne intoxications and the foodborne toxic infections. These are all on the increasing trend. And how safe is our food? From farm to plate, farm to fork, make food safe. See the different types of foods, including the foods of animal origin, and see the hygiene and sanitation. See the diarrhea, the position of diarrhea, the size of the bubble. But the diarrhea kills more young people per year than the HIV, than the measles, than the malaria, and see the size of the bubble. That means 88% of the diarrhea cases worldwide are attributed to unsafe water, inadequate sanitation, and insufficient hygiene. So diarrhea, the gastrointestinal disturbances, which is the major clinical manifestation in case of food poisoning, that is one of the important reason for mortality among the consumers. And see how dirty our nail, especially the food handlers, how the food handlers have to be taken care. see the dirty nail. And in a study conducted in abroad itself, and it was seen that not in abroad, actually it is it was in northeastern part, I think, and 99% of the food handlers, the organism, they could isolate the very common organism which is seen in the dirty nail. The students, do you know which is that? It is the Staphylococcus aureus, and 99% of the food handlers' nail was contaminated with the most common intoxication agent, that is the Staphylococcus aureus. So you have to be very, very careful. And the top countries without sanitation, without the sanitary latrines, that is the figure shown. And India also finds a very good position, 18 million. And now the comparatively, the condition has changed, improved, and this is how the disease gets transmitted from the infected person through the feces and all. It will contaminate your hands, the flies will gets kind of pick up the infectious agent, then it will contaminate the fields, the water bodies and all, and through that the other persons, through the foods and other agents, it will get transmitted to the consumers, and from there again it will be through the fecal agents, and it continues, the cycle continues. And here comes the barriers. The toilet barrier can reduce this part of route of transmission, like that from the water bodies, the safe water barrier, that means the proper disinfection procedure, then this is the hygiene and the hand washing, which can reduce all these routes, and like that you have to. So here also, if you follow proper hygiene, sanitation and hand washing and all, you can control this particular barrier. So you have to find out the weakest linkage, and we have to follow the control measures, and then you can reduce the food poisoning or foodborne infections. These are the common organisms responsible for the foodborne infections, and the Campylobacter, it is considered as the second most important reason for the food poisoning, next to the norovirus, like that Escherichia coli, especially the E. coli O157H7, the enterohemorrhagic E. coli, then hepatitis A, Clostridium perfringens, Shigella, Salmonella, amoebiasis, Staphylococcus aureus. So this food poisoning and all, it is classified under three headings: food poisoning, foodborne intoxication, and the toxic infection. And the Staphylococcus aureus is the best example for the intoxication, whereas the Bacillus cereus and the Clostridium perfringens are the best examples for the toxic infection. There are so many diseases which are transmitted through the foods of animal origin, milk and meat-borne zoonoses, especially listeriosis, tuberculosis, Q fever, Coxiella burnetii, brucellosis, and the other diseases, trichinellosis, toxoplasmosis, cysticercosis, tiniosis, echinococcus, salmonellosis, and there are so many. List is so high. And for the control of these diseases, hygiene from the farm to fork, farm to table, on farm rotational grazing of the pasture, proper ventilation, clean water in farms, pest control, improvement of housing, general cleanliness. Sorry. Sanitary control and provision of adequate rest in the slaughterhouse in the layerage, then proper antemortem and the postmortem inspection, proper disposal of dead animals. So this is the picture showing the meat inspection, the postmortem inspection. The antemortem inspection is carried out in the layerage, in the resting place, and this is how the postmortem inspection is carried out, which is very, very important step to control the disease. Then clean milk production, you have to follow the clean milk production. So this picture shows the different sources of contamination, the poor sanitation, poor storage, infectious and diseases and all, increase the high bacterial increase the bacterial count in the milk, and improper handling also, and that is responsible for the milk-borne diseases. So the WHO has given four important steps for the control of foodborne infections and intoxications. The first step is the clean clean, wash thoroughly the items, the raw materials, especially and the fruits and vegetables and all. And the step 2, that is the separate the edible from the non-edible, the edible from the raw materials. And the step 3, cook thoroughly. Undercooked items are responsible for the occurrence of very many diseases, foodborne infections and all. So avoid that. Proper cooking is very important, and proper storage, proper refrigeration storage. So you have to check the temperature of the refrigerator, and the chilling temperature should be properly maintained to avoid the food poisoning and all. So these are the golden rules for the prevention and control of food poisoning. Keep a clean and safe kitchen. Avoid cross-contamination. Cook food thoroughly. Eat cooked food immediately. Store cooked food carefully. Reheat cooked food thoroughly. Wash hands repeatedly using lots of friction. Protect foods from the insects, rodents, and other animals. Now, need to strengthen the veterinary surveillance system, network of animal disease diagnostic laboratories. We have the CDDL, Central Disease Diagnostic Laboratory. It is located at IVRI Isabnagar. And we have regional disease diagnostic laboratories in different states, including Kerala. We have many RDDLs. And and we have to improve that, the veterinary surveillance system, and the regular surveillance and monitoring of the diseases among the animal population is very, very important to control the disease in human beings. Now, I have included few diseases, actually in short, and the One Health concept for the control of zoonosis. So the disease, the anthrax, we know very well. I'm not going into detail of the etiological age and the mode of transmission, the clinical manifestations and all. I will just go through the One Health concept. So this is the Bacillus anthracis, and this is the malignant pustule, malignant carbuncle. This is the most important cutaneous form of the disease, and the peculiarity of this organism is that it occurs in the vegetative form, and spores are there. Spores on exposure to air, and the spores are highly resistant, and that is why it is taken as a chosen weapon for the bioterrorism. So this is how it is transmitted. The cutaneous part is by the contact, then by ingestion, then by inhalation from the animals, and the human beings gets the disease. And also very rarely through the mosquitoes, and the mechanically by the flies, not the mosquitoes, by the flies, especially the this thing. Okay, and this is the One Health concept. Do not perform a necropsy on suspected animal cases. That is very, very important. If you do the necropsy, immediately there will be exposure of the organism to the outside air, and the sporulation occurs. And the peculiarity of this particular organism, the spores, are that they can retain their viability for long years, more than 100 years. They can remain under favorable conditions in the soil and all, and that is why it's very, very important to avoid the necropsy. Then annually vaccinate the animals, cattle, sheep, horses, goats, and swine in endemic areas using the Stern's vaccine, and treat the infected and the potentially infected animals. During quarantine, these animals should not be used as food. Then veterinarians who work with potentially infected animals in high incidence areas should consider the vaccination. Avoid contact with the blood and bloody discharges. Keep away the flies and the scavengers from the carcasses. Infected carcasses should be burnt and to destroy the spores. Then notify the health department immediately if the cases are diagnosed in animals. Characterize the risk in the community, including whether the cases have been reported in livestock or wildlife, and whether there is possibility of environmental contamination. Work with veterinary authorities to control the disease in animals. Conduct immediate investigation of human cases. Ensure that potentially exposed individuals receive the prophylaxis, post-exposure prophylaxis in endemic areas. Counsel, educate the people, and the clothing and such, all these things should be disinfected properly, and recommend that imported animal hides be disinfected before use, and the reduce environmental exposure risk through the disinfection wherever possible. And for that you can use the formalin. That is about the anthrax. And next is the tuberculosis, the very, very common disease. And these are the main agents: Mycobacterium tuberculosis and Mycobacterium bovis. And the spread of the disease by different ways, including the inhalation, the ingestion, direct contact, indirect contact with the contaminated articles, and mother to offspring through the infected milk. One has to see this picture. This particular organism can affect now each and every part in the body, not only the pulmonary. There are a lot of extra pulmonary cases. And identify, test, and treat high risk populations. Identify infected food or water supply. Avoid close contact of cases to control the secondary cases. Perform tuberculosis test for the screening, and encourage communication between human and veterinary public health specialists. So this is the bone, this is a bone where it is affected with TB. Now, next is brucellosis. There are different species of organisms which can cause this particular disease, including the militensis. Militensis is the type species or the most pathogenic, and that is responsible for the foodborne brucellosis. Foodborne disease is mainly due to this particular organism. There are abortus, zoes, canis. Neotome is comparatively less pathogenic, and maris is the recently identified organism from the marine animals. The transmission again by contact through the air, through the contact with the skin and mucous membrane, through the contaminated milk and meat, the disease gets transmitted. And the One Health concept: analyze the incidence and prevalence of the disease, vaccination, testing and control, educate the public on risk of infection from the pasteurized milk, public awareness about the risk of the disease, and the routes of transmission, etc., and educate the meat handlers about the modes of transmission and the preventive measures to be taken. So that is about the brucellosis, mainly responsible for the abortion. Then educate farmers regarding the personal protection, public health follow-up in cases due to the problems in food safety or lack of safety measures, inform local clinicians about the groups at risk, control measures, etc. Now comes the rabies, the deadly and the costly viral disease. It is the deadly disease and it is costly because whenever there is a suspicion, immediately the people will go and run and take the vaccination. And it is considered as the costly disease. So this is the typical organism, bullet shape. And this particular slide I have included because this is very, very important, because the vampire bats and the haematophagous bats act as carriers. And the peculiarity in bats is that there is storage in the adipose tissue, that they can store the virus in the adipose tissue. So rabies will be the organism, they can store the virus without manifesting the disease, and it causes severe. This is very commonly in the seen in the Latin America, Australia, and all. But the peculiarity is this particular point. That means there is a stage of storage in the adipose tissue, which is not seen in other animals and human beings and all. Now, about the One Health concept: ensure dogs, cats, ferrets, and appropriate livestock are currently vaccinated against rabies. Provide rabies control and prevention guidance to the public, veterinarians, and the clinicians. Avoid animal bites, especially among children, and avoidance of feeding or handling of wildlife or unknown cats and dogs, because the wildlife, if there is a scratch also, it is considered under the category 3. So be careful. Then exclusion of bats from the premises. Usually this at Pukod, our one of our colleges there at Wayanad district, and the lot of monkeys are there, and my students and all, they used to play with the monkeys, and always I used to give them a word of warning, because once there is a scratch or bite or anything from the monkeys, immediately it is considered as a category 3, and you have to go for the immunoglobulin along with the vaccines, and also be careful, I used to tell. So that's very, very important. And advise public about the first aids to be done in bite wound. Work with local human and veterinary medical providers in the management of rabies exposures. Support the pre-exposure vaccination of high-risk individuals, and control of rabies in the wildlife, for which the oral bait vaccines are available, not the injectable form. Now comes the high pathogenic avian influenza, HPAI. So again, the inhalation, the direct contact, Closed and crowded premises may facilitate the spread, especially the wet markets and the contaminated feed, water, equipment, and clothing. All this can act as a source of those organisms and gets transmitted. So this is the transmission cycle. See, the birds, especially the herons and these birds act as the important reservoirs, and migratory birds play a very important role in the transmission of this bird flu. And see the role of pigs. Pigs act as the mixing vessel, and rarely the waterfowl also act as the mixing vessel, where the mixing of these different strains of the influenza virus occurs and the pandemic strains develops. So this is the transmission cycle of avian flu. And the One Health concept include the controlling the source of virus, closing the poultry markets, avoiding contact with the sick animals, animals known to be infected and their environments, using the personal protective equipment, hygienic handling of food, working with poultry, wild game birds, then employing good sanitation and hygiene. Hands should be washed with soap and water before eating, drinking, and rubbing of the eyes should be avoided. And also educate the public about the importance of hygienic practices, educate human health care providers and veterinary clinicians about the groups at risk and its complications, educate travelers about the high pathogenic avian influenza, about the risk, mode of transmission, and importance of taking immediate medical help if signs are manifested. Now comes the few important parasitic diseases, the echinococcosis, the hydatidosis. The parasite is the smallest cyst or the echinococcus granulosus, and the transmission is by the ingestion of food and water, grazing of pasture contaminated with the eggs. So here in this hydatidosis, eggs are the infective stage to man. So close contact with the infected dogs, inhalation of the dust, that is very rare, and the dogs gets the infection. Dogs gets infection by eating of the visceral organs and the cyst. These are the pictures of the hydatid cyst in the heart, in the liver. So One Health concept include provide descriptive epidemiology regarding the risk in the community, prevent dogs and cats from contaminating playgrounds and other public areas with feces, educate the public to thoroughly wash all fruits and vegetables before consumption, and educate the pet owners to not allow the dogs and cats to roam outside or feed on the raw carcasses, and avoid the feeding of raw meat and other offals to the dogs. Next comes the important protozoan disease. This also gets transmitted through the meat and milk and all. That is the toxoplasmosis caused by Toxoplasma gondii, where the cat acts as the complete host. Only cat is required for the transmission of the agent. That means it can act as the complete host, even though this is the transmission cycle where the rats and the other domesticated animals, fruits and vegetables, environment, everything thing can act as the source of this organism, and this is from the pregnant lady it gets transmitted to the fetus. That is another important thing about the Toxoplasma gondii. And educate the for the One Health concept, educate the public on reducing the risk of infection by proper food handling and cooking, appropriate kitchen hygiene, hand hygiene. Then pregnant women and immunocompromised persons should avoid handling soil and cat feces, work with local animal control agencies to encourage control of stray cat population. Role of vets in One Health. So in nutshell, the control of zoonotic disease, biomedical research and food quality and safety, protect biodiversity, natural resource conservation, wildlife management, and the disease surveillance and control and animal welfare, increase the domestic animal protection. And this is in nutshell, supporting the veterinary surveillance programs, sharing information with the public health and the environmental experts, responding to the outbreaks, and monitoring and reporting of the animal diseases, developing policy and preparedness measures, and developing and trialing the vaccines and the diagnostics. So this is in nutshell about the role of veterinarians. So, so I'm moving towards the end. Take home message: you can help to carry the message. Wash your hands, which is very, very important nowadays, especially to control COVID. Keep pets away from the food preparation areas. Keep kids away from the pet animals. Take sick animals to the veterinarians. Be especially careful with people who are at greater risk of contracting the sickness, especially the immunocompromised individuals. Then close collaborative action with the human, animal, and the environmental specialist. And prevention is always better than cure. So let me conclude by quoting the words of Bernard Russell. We know very little, and yet it is astonishing that we know so much, and still more astonishing that so little knowledge can give us so much power to control the disease. Thank you. Thank you very much.
Thank you so much, ma'am, for your extremely excellent presentation. You have very diligently explained all the veterinary perspectives in a very simple and easy understanding way. Thank you so much, ma'am. The discussion will be conducted after the next session. So all the participants are kindly requested to post their questions in the chat box. Now, I take this great opportunity to introduce our next eminent speaker, Dr. Indu. Dr. Indu ma'am is a professor and head Department of Community Medicine, Govt.Medical College, Thrissur. She was a state PEID cell coordinator, member of state rapid response team, state task force for COVID vaccination, state advisory group of immunization, and state adverse events following immunization committee. She has done her research fellowship from University of New South Wales, Sydney, Australia. Ma'am has developed and validated primary care screening questionnaire for depression, a simple 4-item depression screening tool, which was published in the British Journal of Psychiatry. Her PhD work was on development of community-based intervention for managing women with depression in primary care. Some of her recent research works are Government of Kerala WHO Dengue Study 2017-20, ICMR Task Force multicentric study on the consumption pattern of food and food products items high in fat, salt, and sugar among selected cities, towns, and rural population of India, and development and effectiveness of school-based intervention program to manage emotional and behavioral problems of adolescent school students. Research grant awarded by Department of Health Research, Government of India. With this brief introduction, I humbly request you, ma'am, to deliver your talk. Ma'am, please.
Thank you, Sandhya.
Thank you,
Thank you, Mohan sir, CP Vijayan sir, Sandhya, Manu, Anoop, because it's a kind of overwhelming observation of the World Health Day, because we started off with Dr. Muralee Thummarukudy, an international figure. I mean, just we were listening to him, and he came out with many concrete suggestions as to what can be the actions that can be happening at the local level. Now we are in the context of the universities, or in the context of health university levels. Mohan sir has already announced that so much of activities will be done. So it's a great way to observe any day. Otherwise, the observations usually, are restricted to just awareness creation. Actually, carrying forward these messages because the university, these are the centers which generate and disseminate knowledge and information. So that way it's a university is in a very privileged position to carry forward this. Okay. Working together for One Health in the context of today's observing the World Health Day theme, building a fairer, healthier world. നീതിയുക്തവും ആരോഗ്യകരവുമായ ഒരു ലോകത്തെ സൃഷ്ടിക്കുക. നമ്മുടെ വിജയൻ സാർ പറഞ്ഞതുപോലെ സൃഷ്ടിക്കുകയാണ് ചെയ്യേണ്ടത്. So fairer, in global context, there is a lot of connotation to what is fair, how we can make it fair. Similar as healthier, though they are related. Both these are have really dimensions in depth. Actually, COVID. I am sure the Vice Chancellor has chosen One Health as the theme in the context of COVID, and we are looking forward to what can be done to prevent, to face. Actually, we are still in the midst, and we are actually in a rather probably difficult, not probably, actually all over India, the cases are going up, and yesterday it's crossing 1,15,000, and I think it should go up. So Kerala also in a difficult situation. Wherever it is, Kerala, India, or which other part of the world, wherever inequities existed, gaps existed, economies were poorer, resources were poorer, all those places and populations, communities, institutions found it really difficult, and the gaps just widened in the COVID context. So fairness is equity, right? We have to be fair to everyone, to fair to all the students, means everyone gets in terms of chance, it's equity. So even for vaccination, there is a lot of equity. Those countries which could afford to buy vaccines purchased, several times of what they needed, while other poor countries, they're yet to start rolling out their vaccination programs. Today's special focus is on climate change, utilization of resources, land, water, the other natural resources and all. There's a lot of equity. See, we know, I think towards the end, there are a few slides on the international treaties. But നമ്മൾ പറയാ ഈ ഭൂമിയും ആകാശവും ലോകത്ത് ജീവിക്കുന്ന എല്ലാ മനുഷ്യർക്കും, പക്ഷികൾക്കും, മൃഗങ്ങൾക്കും, സസ്യങ്ങൾക്കും, മരങ്ങൾക്കും, എല്ലാ ജീവജാലങ്ങൾക്കും സ്വന്തമാണ്. അപ്പൊ നമ്മൾ ഈ ചൂട് കൂടുമ്പോ ഈ ചൂട് കൂടാൻ ആരാണോ കാരണം, എത്ര പേര്, ഏത് രാജ്യങ്ങൾ, ഏത് ഇൻഡസ്ട്രി is contributing to the global warming, the climate change, they should take the responsibility in bringing down the temperature, right, to the predicted, as Dr.Muralee Thummarukudy was mentioning, around 4 degrees by 2100. So whose responsibility is it? If green air, clean air is everybody's responsibility, see. So that lots of equity issues, not only in climate change, environment, everywhere. So today's theme, let's talk about, being fairer. Naturally, how do we be fair? നമ്മൾ ലോകത്തെ മുഴുവൻ എല്ലാ രാജ്യങ്ങളും എല്ലാ ജനതയെയും കൂടി നോക്കുകയാണെങ്കിൽ definitely in one word, from public health point of view, how do we become fair? Address the social determinants of health. നമ്മുടെ ആരോഗ്യത്തെ നിർണ്ണയിക്കുന്ന സാമൂഹികമായ ഘടകങ്ങൾ നമുക്കറിയാം, വിദ്യാഭ്യാസം ഉൾപ്പെടെ, food security, the resources, healthcare facilities, education. Poverty continues to be the most difficult or most important public health challenge world faces even today. That's relevant even in today's World Health Day theme. So all these addressing all this is at the global level, but then at the local level also, we definitely have to think about at the panchayat level, at the corporation or the state level, what we do. Maybe we have several departments working on it, the public distribution system, the education system, the healthcare system, and we know that several social, the development goals are there. Gender is another area. But in this, among the social determinants, in the context of today's discussion on One Health, neighborhood and environment, that becomes really important, and that is where our discussion should further go on, the environment, the climate change. So even the WHO says, not even WHO, everyone says, this is something which can be preventable. ഇത് ഒരു ബാധ്യതയായിട്ട് ഒരു രാജ്യത്തിന് മാത്രം വരേണ്ട കാര്യമല്ല. ലോകത്തുള്ള റിസോഴ്സസ് ഉപയോഗിക്കുന്നതിലും, അതല്ലെങ്കിൽ എല്ലാ രാജ്യത്തെയും ജനങ്ങൾക്ക് അവർക്ക് വേണ്ടുന്ന സൗകര്യങ്ങൾ ഒരുക്കി കൊടുക്കാൻ ഉള്ള സാഹചര്യങ്ങൾ ഇല്ല എന്നുള്ളത്. ഇനിക്വിറ്റി ഈസ് പ്രിവെന്റബിൾ. ഇത് തടയാൻ പറ്റും. ഇത് തടയാനുള്ള കാര്യങ്ങളെക്കുറിച്ച് ആലോചിക്കുകയും ചിന്തിക്കുകയും പ്രവർത്തിക്കുകയും ചെയ്യുക എന്നുള്ളതാണ്. ദാറ്റ് ഈസ് ദ പർപ്പസ് ഓഫ് ഒബ്സർവിങ് ഓൾ ദീസ് ഡേയ്സ്. സോ ഫെയർനെസ്, ഫെയറർ വേൾഡ്, റൈറ്റ്? Can we create a fairer world? That is the first most important thought of this World Health Day. It's relevant in the one health context as well. Like indirectly or directly, this reflects the Sustainable Development Goals, poverty, hunger, health being the SDG 3, quality education, gender equality, water, sanitation, climate definitely becomes one part of it. Industry, everything, life on land. I think all the Sustainable Development Goals. ഇനി നമ്മൾ ഈ ലോകത്തെ വലിയ കാര്യങ്ങൾ ചിന്തിക്കുകയും പ്രവർത്തിക്കാൻ നമ്മൾ ഏറ്റവും നമ്മുടെ വീട്ടിൽ അല്ലെങ്കിൽ നമ്മുടെ സ്ഥാപനത്തിൽ നമ്മുടെ സ്വന്തം കാര്യത്തിൽ വേണം എന്ന് പറയുന്നത് പോലെ. So what should we do for a healthier and fairer Kerala? If we consider the public health challenges that Kerala faces, to create a healthier Kerala, definitely the concern is lifestyle disorders like hypertension, diabetes, heart disease, etc. To create a healthier Kerala, our focus has to be on three more important. There are several. If you think about global, there may be malaria, there may be many other conditions. But Kerala, we are more focused on, we have to be, even in the COVID context, we have to take care of our food. What do we eat? ഇപ്പൊ ഇത് കണ്ടുകൊണ്ടിരിക്കുന്ന 200 പേര് അല്ലെങ്കിൽ എത്ര പേരാണോ അത്രയും പേർക്കും ബാധകമായിട്ടുള്ള ഒരു കാര്യമാണ് ഫുഡ്. So what change are we making in our own daily menu to make it healthier? For us to have a healthier life, to create a healthier world, what contribution from our personal. So that is diet. I think I've included the food plate in today's presentation. It may appear insignificant, but as Muralee Thummarukudy said, public health, preventing as Christian Bernard said, I should have started working at public health if I knew that I could have prevented several, heart attacks and deaths than doing open heart surgery. So every specialty is important, but prevention in the context of lifestyle disorders and eating better is really important for the Kerala. നമ്മൾ ഓരോ പ്രാവശ്യവും നമ്മൾ കഴിക്കുന്ന cereals വളരെ വളരെ കൂടുതലാണ്. The American guidelines have come out for the dietary guidelines have come out. They've restricted the cereals to 6 ounces. 6 ounces is equivalent to 6 slices of bread. നമ്മൾ രാവിലെയും ഉച്ചയ്ക്കും രാത്രിയും വൈകുന്നേരവും എല്ലാം കൂടി കഴിക്കുന്ന അരിയോ ഗോതമ്പോ എന്ന് പറയുന്ന ധാന്യം, cereals have to be restricted to what is equivalent to 6 slices of bread. 6 slice breadന് equivalent. ഒരു ബ്രെഡ് ഒരു ചപ്പാത്തി 1 ounce ആണ് അത്. അത്രയും മതി. ഇതിനെ കഴിയും വളരെ വളരെ കൂടുതലാണ് നമ്മളിപ്പോൾ കഴിക്കുന്നത്. അപ്പൊ അതില് നമ്മൾ ഓരോരുത്തരും നമ്മളുടെ ഭക്ഷണത്തിൽ അത്രയും കുറവ് വരുത്തേണ്ടത് വളരെ അത്യാവശ്യം. Then half the plate has to be fruits and vegetables. We have been speaking about this, but this is not yet practical, right? One of my postgraduates did a thesis. She actually received, Dr. Arya Rahul, she received the best PG CR Suman award recently for her PG thesis. And I was looking through her data yesterday because she was writing a paper on that. And then the amount of fruits and vegetables we should eat every day, maybe 500 grams. നമ്മൾക്ക് ഗ്രാമിൽ പറയുന്നതാണ് കുറച്ചുകൂടി മനസ്സിലാവാൻ എളുപ്പം. ഇതിന് 400 grams. So even weekly, most of our people do not take that. So we are taking much less than what is required to keep us healthy. So increase the fruit and vegetables, reduce the cereals. Then exercise. Again, we have to focus on that. Children are not, moving. They have to go, play, run. Women have to do that. Lots of gender issues there also, right? Very few women, like the proportion of women in Kerala who have daily physical activities less. It can be indoor, but then let them sweat out. ഇത് നമ്മളുടെ ഒരു cultural ശീലമായിട്ട് മാറിയിട്ടില്ല. For a healthier Kerala, these simple things are going to make a big difference. Otherwise, the number of dialysis centers will increase, the number of ICUs will increase. We will have to spend a lot of money. As Madam was saying, rabies is a costly disease. Of all lifestyle disorders are costly diseases. So let us spend. Actually, healthier diet is much costlier than unhealthy diet. Vegetables are expensive. Fruits are expensive. Actually, 1/4 the plate has to be pulses, means pulses or proteins. So actually pulses, pyrin and I think 3 times or so, 3 to 4 times higher, costlier than cereals. So even the public, so we may require some policy decisions at the public distribution system to probably replace rice with pulses. Then for exercise also, the time, facilities, affordability, I think university can have a role because we have, as I said, 100,000 students with us. 1 ലക്ഷം വിദ്യാർത്ഥികളാണ് health university the accident. So these are all potential areas for a healthier Kerala: alcohol accidents, mental health, child interventions. Now, what is the framework for working towards One Health? As Madam said, it's collaborative, it's multi-sectorial, it's transdisciplinary. നമുക്കിപ്പോ intersector ആണുള്ളത്. Intersectoral means, there is an outbreak, the veterinarians come, the health department comes, water authority comes, we say intersectoral coordination. In transsectoral, transdisciplinary, the term itself, the boundary just dissolves. And we have, naturally, as Madam has diagrammatically shown, we have us, the humans, the animals, plants, and the environment. There are several potential areas of work: food safety, zoonotic diseases, laboratory services. Actually, now even in rabies and all, many collaborative laboratory work happens. Neglected tropical diseases like dengue, environmental health, antimicrobial resistance, several potential areas of work. So I think I'll just come to the other areas where collaborative work can happen at the university level. So lab scientists, veterinarians, physicians, nurses, scientists, psychologists, policymakers. But when it comes to One Health, it is not these experts alone who matter. Everyone matters. Everyone who buys, eats food, drinks, swims in water. നമ്മള് പുറത്തുനിന്നും ഭക്ഷണവും കഴിക്കാത്തവരാരില്ല. We have to eat. So everyone, One Health is everybody's concern. So what shall we do? One is practicing healthy pet habits. Madam has discussed several micro details of that. Keep wildlife wild. Madam പറഞ്ഞു കൊരങ്ങന്മാരെ കളിപ്പിക്കാൻ പോരുതെന്നുള്ളത്. That's one thing. And I think this is one area where more policy decisions would be required. Because as our Vice Chancellor was mentioning in his inaugural speech, the wet markets of China, for that matter, some of the Asian countries might be. So definitely policy decisions on them, and definitely informing people about this. So wild has to be wild. ഈ ഭൂമിയിൽ നമുക്ക് അറിഞ്ഞുകൂടാത്ത, നമ്മുടെ ആദ്യത്തെ സ്പീക്കർ പറഞ്ഞ പോലെ നമുക്ക് അറിഞ്ഞുകൂടാത്ത കോടിക്കണക്കിന് ഓർഗാനിസംസ് നമ്മുടെ കൊടും കാടുകളിലോ മലനിരകളിലോ ഉറങ്ങുകയല്ല. they have their own ecosystem, right? ഇതിനെ നമ്മുടെ ഇടയിലേക്ക് കൊണ്ടുവന്നാൽ നമ്മളത് കണ്ടുപിടിക്കാനുള്ള lab, I think that's why we should work together. But then even working together, there is a huge cost involved in it, right? So keeping wildlife wild is a real important action that has to happen in every country. എല്ലാ രാജ്യങ്ങൾക്കും കാട്, എത്ര കാട് ഉണ്ടെന്ന് ഇപ്പൊ ആമസോൺ അങ്ങനെയൊക്കെ ഒരുപാട് കാടും മലകളും ഒക്കെ ഉള്ള രാജ്യങ്ങളുണ്ട്. പക്ഷെ അങ്ങനെയുള്ള രാജ്യം എനിക്ക് തോന്നുന്നു അതിനേക്കാളും ബുദ്ധിമുട്ട് എനിക്ക് തോന്നുന്നു നമ്മളെ പോലെയുള്ള ഈ കുറച്ച് സ്ഥലങ്ങളുള്ള സ്ഥലമാണ്. And then definitely partnership. And today I think it's a great beginning on the World Health Day in terms of this partnership and communication, constant communication. And I think soaps are doing real magics now. So just 2-3 slides on animals, how we should handle them. Definitely washing with soaps, especially children. because leptospirosis, we look at the IDSP, the Integrated Disease Surveillance Project data for 2020 or even this year, one very disturbing death, one set of deaths, one disease is leptospirosis, a zoonotic disease. And there, very often it need not be the rats. Other domestic animals, how we handle animals. Other pashuvaga, beetle nammal valarthunna matta animals agam. So handling animals is really important. Definitely washing hands, and madam has given other. So how do we take care of them? Clear visits, vaccines, deworming and other things, and educating. So as Mohan sir was committing in his response to Dr. Muralee Thummarukudy, it is really important that it becomes part of the education, some mandatory kind of course, placing ourselves, the Homo sapiens, as one component of, where we have other components like the plants, animals, and the environment. And then identify Kerala's top 5 priority zoonotic diseases. I mentioned Kerala. If it is India, it is India's. So the country's top priorities. And then we should have strategies. I think in all these steps, university has a role, right? University, I think all of us are now part of the university. So developing strategies for this, building lab capacities, surveillance. So now the surveillance, the animal surveillance and the surveillance of human diseases are done by different departments. Definitely one is the health department, the other is the veterinary department. Only in outbreak response teams, there's a constant exchange, but this constant exchange of data, information, inferences has to happen. And there is something called a planning outbreak. This is actually happening to Kerala to a great extent. This is happening. This has been happening for the diseases that we know. For example, dengue every year. So actually every year, for the past several years, health department has an annual action plan. There is an initial meeting, intersectoral meeting, even the CM holds that meeting, and then all the stakeholders are on board. And then the water authority, what are the water areas where the water scarcity is there, during drought, give water so that people don't store. All that happens. But this is the scope of this is widening. Several examples. I think I'll skip this because Nipah has already been mentioned. And to pick this up, what is one of those, I'll just mention one or two recent developments in medical colleges. The speed cell is not a recent development. It has been there for quite some time. The prevention of epidemic and infectious diseases cell, actually, all the communicable disease data from medical colleges, I think private medical colleges also go to both the district and the, district medical officer and also to the state. In the context of One Health, after Nipah, outbreak monitoring units have been formed. There's a government order for that, wherein if there is a trigger, for example, the Nipah, as we know, the Baby Memorial Hospital, the cases, initial cases, even the Calicut Medical College, the index case, and the first that we think as the first, they all had encephalitis-like symptom. They also had respiratory symptoms. So if there is clustering, if there is an abnormal trigger, a signal, the so-called syndrome X. So any of so in tertiary care institutions where these serious patients come, there is a mechanism to note that and flag it. Those are called outbreak monitoring units. This is functioning now. The intersector, we have the veterinary experts from many from the laboratory side. But then that real trans-sector hope will come through. And just to continue the discussion on the university, I'm sure the Vice Chancellor will comment or, carry this forward. A lot of scope for trans-sectoral work, research, especially the academics. Actually, if a course also begins, then that can be a good beginning between the health university and the veterinary and animal science university and agencies. Actually, we had a big beginning today when we had a UN expert with us. So several agencies at the national, international, and at the state level who work in the area of One Health. So university actually, I'm sure will collaborate with all these agencies to come out with state-of-art, not only research, but then new courses. Because this is where university is a place where we generate and disseminate knowledge, information, and that is power. And just to complete, One Health is about human, animal and plant, and plus the environment. The environment, ഒരു ചെറിയ environment നമ്മുടെ ഒരു control, but then for that matter, even air pollution, indoor air pollution is really important. Mesothelium and asbestos, Dr.Muralee Thummarukudy mentioned. But then indoor air pollution also becomes a part. The construction materials that we use. Actually, very recently, I think some 1 or 2 weeks ago, the meeting on finalization of the climate change document happened in Trivandrum. And there was a lengthy discussion on what can be done to reduce indoor air pollution. So the framework is quite elaborate. And as in 1992, it is the basic legal framework for international climate change cooperation with the aim of stabilizing atmospheric concentration of greenhouse gases to avoid dangerous anthropogenic interference with the climate system. So as early as in 1992, the UN framework on the Kyoto Protocol 1997 commits industrialized countries and countries in transition to a market economy to achieve quantified emission reduction. ഇപ്പൊ ഇതൊക്കെയാണ് പിന്നെ പല രാജ്യങ്ങളും അത് സമ്മതിക്കുകയും സമ്മതിക്കാതിരിക്കുകയും ചെയ്തത്. And then the first commitment period, 2008 to 12, then the Doha Amendment came, and the second commitment period ended last year, but the meeting could not be convened 2020 in Glasgow, UK, because of the COVID. In between, the Paris Agreement came, and so there is everything is not fair and good. Healthier even in the One Health concept, because now the US administration has changed, but the previous administration, right? Its response to global commitment was really very like people were worried, right? It was really worrisome, but now it has changed. So One Health in real action depends on several policies, several stakeholders at the global, national, local, and probably finally at our personal level. To conclude, the purpose of World Health Days is to create awareness, but then if a few actions are initiated, that is the best way to observe World Health Day. Thinking locally, I think now the local as really a university with several thousands of faculty and students. So many of these, actually Kerala in 2017 is one example where in 2017 the theme was Depression Let's Talk, and Deepika Padukone was the ambassador for that. And then Government of Kerala initiated a program called Ashwasam and started Ashwas clinics and the Family Health Center. So that was in the context of observing the World Health Day. Similarly, some actions that happen in relation to this, observing these days would be great. Once again, I thank the Vice Chancellor Pro Vice Chancellor, Anup, Sandhya, and everyone for the opportunity. Thank you everyone for the patient listening. Thank you, Latha Madam and Dr. Muralee Thummarukudy for their excellent speeches. It was a real pleasure participating.
Thank you so much, ma'am. Your presentation was really a very pleasant, informative, and excellent talk. Thank you so much for your excellent talk, ma'am. Now the session is open for discussion, and participants can post your questions in the chat box, and we can take over the questions. There's a question in the chat box for Latha, ma'am. Ma'am, there's a question. Do we have proper examination of meat in butchery shop here? What about the health checkups of persons working there?
Okay, I have seen that. Regina ma'am, good afternoon. ശരിക്കും പറഞ്ഞാൽ ഇല്ല, ഒരു സംശയവുമില്ല. കൃത്യമായിട്ടുള്ള മീറ്റ് ഇൻസ്പെക്ഷൻ, സയന്റിഫിക് വേ ഓഫ് ഓർ ഹൈജീനിക് പ്രൊഡക്ഷൻ ഓഫ് മീറ്റ് നടക്കുന്നില്ല. നമുക്ക് നമ്മുടെ മണ്ണുത്തി വെറ്റിനറി കോളേജിനോടനുബന്ധിച്ച്, is it clear? Can you hear?
Yes, ma'am. Yes.
മണ്ണുത്തി വെറ്റിനറി കോളേജിനോടനുബന്ധിച്ച് നമുക്കൊരു മീറ്റ് പ്ലാന്റ് ഉണ്ട്, ഹൈജീനിക് മീറ്റ് പ്രൊഡക്ഷൻ. അതിനുവേണ്ടി കൃത്യമായിട്ട് നമ്മളിവിടെ റെഗുലർ ആയിട്ട് ട്രെയിനിങ്സ് എല്ലാം കൊടുക്കുന്നുണ്ട്. ശരിക്കും എല്ലാ പഞ്ചായത്ത് ലെവലില് അങ്ങനെ ഒരു സ്ലോട്ടർ ഹൗസ്, ചെറിയ ലെവലിലുള്ള സ്ലോട്ടർ ഹൗസ് ചെയ്യാനായിട്ട് പഞ്ചായത്തിൽ നിന്നൊക്കെ പ്ലാൻ പ്രോജക്ട്സിലൊക്കെ പൈസ ആക്കാറുണ്ട്. പക്ഷെ ഇതുവരെയും അത് ഇംപ്ലിമെന്റ് ചെയ്തിട്ടില്ല. അതുകൊണ്ട് തന്നെ നമുക്ക് എസ്പെഷ്യലി സൺഡേസിലൊക്കെ നമുക്ക് കാണാം, ഒരു ഏതെങ്കിലും ഒരു എല്ലാവരും സൺഡേ നടന്ന് ലോക്കൽ മാർക്കറ്റ്സ് ഒരു യാതൊരു ഇൻസ്പെക്ഷനും ഇല്ല, ഒന്നുമില്ലാതെയുള്ള ബുച്ചറി ഷോപ്സ് ആണ്. അതൊരിക്കലും നമുക്ക് സമ്മതിക്കാൻ പറ്റാത്ത കാര്യമാണ്. നമുക്ക് ഒത്തൊരുമിച്ച് തന്നെ അതിനെതിരെ നേരിടണം എന്നുള്ളതാണ്. കാരണം ശരിക്കും ഹൈജീനിക് മീറ്റ് പ്രൊഡക്ഷൻ ഇസ് വെരി വെരി ഇമ്പോർട്ടൻറ്റ് ടു കൺട്രോൾ മെനി ഓഫ് ദ മീറ്റ് ബോൺ ഡിസീസസ്. അതുകൊണ്ട് എല്ലാ പഞ്ചായത്ത് ലെവലില് സ്ലോട്ടർ ഹൗസസ്, ചെറിയ രീതിയിലുള്ള സ്ലോട്ടർ ഹൗസസ് കമ്പൽസറി ആയിട്ട് വേണം. ഓൺലി അങ്ങനെയുള്ള സ്ലോട്ടർ ഹൗസസ് എന്നുള്ള മീറ്റ് മാത്രമേ നമ്മൾ വാങ്ങിക്കുള്ളൂ എന്നുള്ളത് കൺസ്യൂമേഴ്സും കൂടെ വിചാരിക്കണം. കാരണം ഇത് ശരിക്കും ഒത്തൊരുമിച്ച് ചെയ്യേണ്ട കാര്യമാണ്. അത് ഒരു എന്താ പറയുക, അഡ്മിനിസ്ട്രേറ്റീവ് പാർട്ടെന്ന് മാത്രം, അല്ലെങ്കിൽ അങ്ങനെ അതോറിറ്റീസ് മാത്രം, അങ്ങനെയല്ല, നമ്മളും കൂടെ വിചാരിക്കണം. അത് മാഡം പറയുന്നത് കറക്റ്റ് ആണ്, ഹൈജീനിക് മീറ്റ് പ്രൊഡക്ഷൻ നടക്കുന്നില്ല.
Thank you, ma'am. There's another question. Your advice to handle domestic animals and pets.
പെറ്റ് അനിമൽസ് ഇല്ലാതെ നമുക്ക് ജീവിക്കാൻ പറ്റില്ല. അതിനൊക്കെ കൃത്യമായിട്ടുള്ള സയന്റിഫിക് മെത്തേഡ്സ് ഓഫ് റെയറിങ് ഓഫ് ആനിമൽസ് ഉണ്ട്. പ്രത്യേകിച്ചും പെറ്റ് അനിമൽസ് ഒക്കെ ആയിട്ട് കുട്ടികൾ, അതായത് സയന്റിഫിക് മെത്തേഡ്സ് എന്ന് പറഞ്ഞാൽ ഫീഡിങ്, ഹൗസിങ്, അങ്ങനെയുള്ള എല്ലാ കാര്യങ്ങളും നമ്മൾ ശ്രദ്ധിക്കണം. ഡിസീസിന്റെ കാര്യത്തിലാണെങ്കിൽ കൃത്യമായിട്ടുള്ള സ്ക്രീനിങ് വേണം. അതുപോലെ വാക്സിനേഷൻ, എസ്പെഷ്യലി റേബീസിന്റെ ഒക്കെ കൃത്യമായിട്ട് റെഗുലർ വാക്സിനേഷൻ, ആൻഡ് യു ഹാവ് ടു ഗോ ഫോർ ദ രജിസ്ട്രേഷൻ വേണം, ലൈസൻസിങ് വേണം. അതുപോലെ കുട്ടികള് മൃഗങ്ങളുമായിട്ട് കളിക്കാതിരിക്കില്ല, ഉറപ്പാണ്. പക്ഷെ കൃത്യമായിട്ടുള്ള വാക്സിനേഷനും കാര്യങ്ങളൊക്കെ ചെയ്തതാവുമ്പോൾ നമുക്ക് യാതൊരു ഇഷ്യൂസും ഇല്ല. മാത്രമല്ല ആനിമൽസിനെ ഹാൻഡിൽ ചെയ്ത് കഴിഞ്ഞാൽ നന്നായിട്ട് കൈ വാഷ് ചെയ്ത് സോപ്പും ഇതും വെച്ചിട്ട് തന്നെ വാഷ് ചെയ്യണം. അതുപോലെ കുട്ടികളും കൂടെ ശരിക്കും നമ്മൾ എവറി വേൾഡ് സൂണോസിസ് ഡേ വി യൂസ് ടു സെലിബ്രേറ്റ് വിത്ത് ദ സ്റ്റുഡൻസ്, സ്കൂൾ സ്റ്റുഡൻസ്, ആൻഡ് വി ഹാവ് എ പ്രോഗ്രാം നോ സൂണോസിസ് ടു നോ സൂണോസിസ്. ദാറ്റ് മീൻസ് KNOW, നോ സൂണോസിസ്. സൂണോസിസിനെ കുറിച്ച് അറിയുക. എന്തിനു വേണ്ടി? കംപ്ലീറ്റ് സൂണോസിസ് ഇല്ലാതാക്കാൻ. നോ സൂണോസിസ് ടു നോ സൂണോസിസ്, എന്നോ സൂണോസിസ്. അതാണ്. അത് നമ്മൾ സ്കൂൾസ് കേന്ദ്രീകരിച്ചാണ് ചെയ്യാറുള്ളത്. കാരണം സ്കൂൾ സ്റ്റുഡൻസിനെ പഠിപ്പിക്കുകയാണ് ദ ബെസ്റ്റ് വേ. നമുക്ക് കൂടുതൽ റീച്ച് കിട്ടാനായിട്ട് എപ്പോഴും സ്കൂൾ സ്റ്റുഡൻസിനെ പഠിപ്പിക്കുകയാണ് ഏറ്റവും നല്ലത്. അപ്പോൾ സ്റ്റുഡൻസിന് ഇതിനെക്കുറിച്ചുള്ള കൂടുതൽ അവയർനെസ് ക്രിയേറ്റ് ചെയ്യണം, എങ്ങനെ ഡിസീസസ് കൺട്രോൾ ചെയ്യാൻ പറ്റും എന്നുള്ള അങ്ങനത്തെ എല്ലാ കാര്യങ്ങളും കുട്ടികളെയും കൂടെ പഠിപ്പിക്കണം. കുട്ടികൾ അതുപോലെ എപ്പോഴും വാഷ് ചെയ്ത്, അല്ലെങ്കിൽ ഭക്ഷണത്തിന് മുൻപും അങ്ങനെ ടോയ്ലറ്റ് യൂസ് ചെയ്ത് കഴിഞ്ഞിട്ടും ഒക്കെ കൃത്യമായിട്ടുള്ള വാഷിംഗ് ഓഫ് ഹാൻഡ്സ്, അങ്ങനെയുള്ള ഹൈജീനിക് സാനിറ്ററി മെഷേഴ്സ് അവർ ചെയ്യാനായിട്ട് അവർ ശ്രദ്ധിക്കണം. അവർ ഇതിനെപ്പറ്റി അവെയർ ആക്കണം. അതാണ് വേണ്ടത്.
The next question is for Indu ma'am. Are we consuming excess meat products to the level which is hazardous to health?
Thank you, Vijayan sir. Actually, more than the meat, high fat, salt and sugar. ഇതാണ് നമ്മൾ കൂടുതൽ കഴിക്കുന്നത്. അതിൽ ഫാറ്റ് ആണ് കൂടുതൽ കഴിക്കുന്നത്. ഫാറ്റ് എന്ന് വെച്ചാൽ നമ്മളുടെ ടോട്ടൽ ഇഫ് യു ലുക്ക് അറ്റ് ദി പെർ ക്യാപിറ്റ കൺസംഷൻ, right, our salt consumption is 10 or 12 grams per day, while ideally it should have been below 5 grams per day. So we consume a lot of salt. And the salt source can be many. It can be from pickles, it can be from any of those preserved ones, bakery items, biscuits. All these are, sources of high salt. Then fat content is higher, especially trans fat, that is higher. And then sugar, added sugar, and the total, intake of cereals is also higher. Regarding meat per se, the protein intake per se, fish, meat, egg, milk, and pulses. These are the usual sources of protein in our diet. See, actually, we require just 1 gram per kg of protein per day. And then it may be 60 grams. So actually, if we take rice, a lot of rice, 100 grams of rice gives you 6.8 grams of protein. If it is wheat, 11.8 or 12 grams of, then an egg gives you 6 grams of protein. 100 grams of fish, 20 grams. Most of the pulses give 20 grams. So it's rather easy to get the protein, but then meat per se, we don't have a data. I do not know the data on, what is the per capita meat consumption in Kerala. But in general, from that plate part, we eat much more rice. ഇപ്പൊ നമ്മളെ പ്ലേറ്റിൽ ഏതാണ്ട് നിറച്ച് cereals. ഏത് ഡയറ്റ് അനലൈസ് ചെയ്താലും നമ്മൾ നോക്കുമ്പോൾ നമ്മൾ കഴിക്കുന്ന ഈ cereals ഒരുപാട് എക്സസും വെജിറ്റബിൾസ് ആൻഡ് ഫ്രൂട്ട്സ് വളരെ വളരെ കുറവുമാണ്. പക്ഷെ ഈ പ്ലേറ്റിന്റെ 1/4 പ്രോട്ടീൻ എന്ന് പറയുമ്പോൾ ഇറ്റ് ക്യാൻ ബി പൾസസ്, ഇറ്റ് ക്യാൻ ബി ഫിഷ്, കറിവെച്ച മീൻ. It can be egg. Naturally, 1 egg gives us, 6 grams of protein, but 250 milligrams of cholesterol. So every day, our total requirement of cholesterol per day is 200 milligrams only. 1000 കലോറിക്ക് മതി. 2000 കലോറിക്ക് നമുക്ക് 200 മില്ലിഗ്രാം കൊളസ്ട്രോൾ മതി. അത് നമ്മൾ പല പല സോഴ്സിൽ നിന്ന്, ആനിമൽ സോഴ്സിൽ നിന്ന് മാത്രമേ കൊളസ്ട്രോൾ കിട്ടൂ. അല്ലാതെ നമ്മൾ സാച്ചുറേറ്റഡ് ഫാറ്റി ആസിഡ് കഴിക്കുകയാണെങ്കിൽ നമ്മുടെ ബോഡിയിലാണ് അതിനെ അതിലോട്ടും കൺവേർട്ട് ചെയ്യുന്നത്. എനിവേ, our consumption of oil is higher, our consumption of salt is higher, our total consumption of cereals and all sorts of sugar is higher. And we have to enhance our pulse intake. So I think meat product in the sense, red meat, ഒരുപാട് കഴിച്ചു. ലത മാഡത്തിന് അതിന്റെ ഡേറ്റ ഉണ്ടോ എന്ന് എനിക്ക് അറിഞ്ഞുകൂടാ. നമ്മൾ കേരളീയൻ ശരാശരി എത്ര റെഡ് മീറ്റ് അല്ലെങ്കിൽ ചിക്കൻ അല്ലെങ്കിൽ മട്ടൺ കഴിക്കുന്നു എന്നുള്ളത്. ആസ് വി നോ, റെഡ് മീറ്റ് എപ്പോഴും പല നമ്മുടെ എന്താ പറയുക, ഇതൊന്നും all this I think actually animal sources are richer sources of protein than plant sources because bioavailability is higher for animal source. So what is important is that we have to reduce the fat content. We have to reduce the total oil that we add while cooking. Reduce the times we take fried items. ഈ വറുത്തതും പൊരിച്ചതും ഒക്കെ ഒഴിവാക്കുക എന്നുള്ളതാണ്. Definitely quantity also matters. We need only 1 gram per kg of protein from all these sources. Meat also 100 grams gives us around 20 grams of protein. So it need not be really in excess. But then, 1/4 protein in a plate means we can have these multiple sources which make up to nearly 1/4.
ഞാൻ ആഡ് ചെയ്യട്ടെ ഡോക്ടർ ഇന്ദു. മീറ്റ് കൺസംഷൻ ഒരിക്കലും നമ്മുടെ ICMR റെക്കമെൻഡേഷൻ ലെവലിലേക്ക് എത്തുന്നേ ഇല്ല. Per capita consumption is much lower than the ICMR recommendation. About 31 ഒക്കെ ഉള്ളൂ. ICMR recommendation അതിനേക്കാൾ ഒരുപാട് കൂടുതലാണ്.
കാരണം ഇതില് നമ്മൾ ആലോചിച്ച് നോക്കിയാലേ അറിയാലോ, നമ്മുടെ പ്ലേറ്റിന്റെ 4/1 പയറ് വർഗ്ഗങ്ങൾ അല്ലെങ്കിൽ പ്രോട്ടീൻ സോഴ്സസ് ആണ്. 4/1 നമ്മളെ ചോറ് വേണ്ട. നമുക്കറിയാലോ, നമ്മൾ ചോറ് പ്ലേറ്റ് നിറച്ചെടുത്തിട്ട് ചോറും പയറും ഒരേ അളവിലാണ് നമ്മൾ കഴിക്കേണ്ടത്. അല്ലെങ്കിൽ അതിന്റെ പ്രോട്ടീൻ പകുതി, ബാക്കി ഫ്രൂട്ട്സ് ആൻഡ് വെജിറ്റബിൾസ് ആണ്. അപ്പൊ നമ്മുടെ ആ വിഷ്വൽ പിക്ചറിൽ നിന്ന് തന്നെ അറിയാലോ, നമ്മളെപ്പോഴും സിറിയൽസ് ഓവർഡൂ ചെയ്യും, മറ്റത് കുറച്ചുമാണ് കഴിക്കുന്നത്. Of course, milk, if you are consuming, that compensates for protein. വിജയൻ സർ, ഇതാണോ ഉദ്ദേശിച്ചത് സർ?
But per capita is an average. But yes, there are people who are consuming more red meat. That is what I want.
Which is not good, sir. Anyway, that is not good. That's not good. Consuming, that's true, sir. Actually, some of the recent studies have shown that the childhood obesity is really high. We have higher proportion of pre-hypertensives and impaired glucose tolerance among adolescents and even childhood. Actually, childhood waist-hip ratio is a direct predictor of future heart disease. Metabolic syndrome ഇല്ലേ? ഇപ്പൊ ഈ കുടവയറാണ് ഒരു പ്രശ്നം. കുടവയർ എന്ന് പറയുന്നതിനകത്താണ് ഇൻസുലിൻ റെസിസ്റ്റൻസ്, അബ്ഡോമിനൽ ഒബീസിറ്റി. അപ്പൊ അത് ഹാർട്ട് ഡിസീസുമായിട്ട് ഡയറക്ട്ലി, ഇപ്പൊ നമ്മള് മെറ്റബോളിക് സിൻഡ്രോം എന്ന് പറയുന്ന ഹൈപ്പർ ടെൻഷനും ഡയബറ്റിസും ലിപ്പിഡ് ഗ്ലൂക്കോസ് മെറ്റബോളിസത്തിലുള്ള പ്രശ്നമാണ്. അത് ഹൈപ്പർ ടെൻഷൻ, ഇമ്പയർഡ് ഗ്ലൂക്കോസ് ടോളറൻസോ കൊളസ്ട്രോളോ ഒക്കെ ആകാം. അതിൽ ഏറ്റവും പ്രധാനം വേസ്റ്റ് റേഷ്യോ അല്ലെങ്കിൽ അബ്ഡോമിനൽ സർക്കംഫറൻസ് ആണ്. നമുക്ക് ട്രെയിനിലോ ബസ്സിലോ എവിടെ പോയാൽ നോക്കിയാൽ വയറ് നോക്കിയാൽ മതി ആളുകളുടെ. എല്ലാവർക്കും വയറുണ്ടായിരുന്നു. ഇത് മെറ്റബോളിക് സിൻഡ്രോം ആണ്. നമ്മൾ ഈ പറയുന്ന സയൻസിനെ നമ്മൾ സാധാ ഭാഷയിലോട്ട് മാറിയാൽ കുടവയറാണ് ഈ മെറ്റബോളിക് സിൻഡ്രോം കണ്ടാൽ അറിയാവുന്നത്. So that is really high, sir. Obesity is really high, and our children, especially junk, actually fried, these items are considered junk because lifestyle. At what age, there's a question in the chat box, at what age should we be cautious and test regularly? That's a very important question. Actually, it should begin in the childhood. The Framingham Heart Study is the biggest cohort. They have now the 3rd generation, began in the 40s, and now they have the data from the 3rd generation. And there are studies which show that in obesity ജനറ്റിക് ആയിട്ട് ഹെറിഡിറ്ററി ആയിട്ട് വരുന്നതിനേക്കാൾ കൂടുതൽ നമ്മളുടെ ശീലങ്ങളാണ്. ഇറ്റ് റൺസ് ഇൻ സൊസൈറ്റീസ്. അമ്മയും അച്ഛനും കഴിക്കുന്നത് എന്താണോ അത് കുഞ്ഞിന് ചെറുതിലേ മീൻ പൊരിച്ചാണ് കൊടുക്കുന്നത്. അതല്ലെങ്കിൽ ചിപ്സും ഇതൊക്കെ റെഗുലർ ആയിട്ട് ബിസ്ക്കറ്റും അതും ഇതും കൊടുത്താൽ മാത്രമേ അവർ കഴിക്കത്തുള്ളെങ്കിൽ അതാണ് അവരുടെ ഇഷ്ടം, അതാണ് അവരുടെ ശീലം. അതിന് പകരം പഴവും, ഇപ്പൊ തണ്ണിമത്തന്റെ സീസൺ ആണ്, വാഴപ്പഴം 200ഓളം വാഴപ്പഴങ്ങളുണ്ട് കേരളത്തിൽ. ഏതെങ്കിലും പഴമോ പപ്പായ പേരയ്ക്ക ഇതൊക്കെ കൊടുത്താണ് ശീലിക്കുന്നതെങ്കിൽ, തക്കാളിയും പഴമാണ്, ഇതൊക്കെ കൊടുത്താണ് ചെറിയ കുട്ടികൾ ശീലിക്കുന്നതെങ്കിൽ, ഞാൻ തക്കാളിയുടെയൊക്കെ കാര്യം പറയുന്നത്, നമ്മൾ ഓരോരുത്തരും പ്ലേറ്റിന്റെ പകുതി പച്ചക്കറി ആക്കണമെങ്കിൽ അത് അവിയൽ കഴിച്ചാൽ ആവൂല. കാരണം അവിയൽ എന്ന് പറഞ്ഞാൽ വീണ്ടും അതിൽ ട്യൂബേഴ്സും തേങ്ങയും ഒക്കെയാണ്. ഗ്രീൻ സാലഡ്സ് ആണ് ആഡ് ചെയ്യേണ്ടത്. ഇപ്പൊ ഈ ഗ്രീൻ സാലഡ് അത് വെള്ളരിയോ തക്കാളിയോ എന്തോ ആകട്ടെ, അപ്പൊ ഇതൊക്കെ ചെറുപ്പത്തിലേ കഴിച്ച് ശീലിച്ചാൽ മാത്രമേ നമ്മൾ വലുതാവുമ്പോഴേ കഴിക്കൂ. ഇപ്പൊ നമ്മളെ യൂത്ത് only film actresses, film actors and models adhere to a strict healthy diet. It need not be without taste. We have to revolutionize the way we cook. നമുക്ക് ഇഷ്ടമുള്ള രുചിയുള്ള രീതിയിൽ, അതേസമയം എണ്ണയൊക്കെ കുറച്ചും ഈ വറുക്കുന്ന ഭാഗം കുറച്ചും ഒക്കെ നമ്മൾ കുക്ക് ചെയ്യണം. അപ്പൊ ഈ കുട്ടികളിലേ അത് വേണം. അപ്പൊ നമ്മളെ ഇങ്ങനെ നന്നായിട്ട് ഇതെല്ലാം കഴിച്ച് 10-30 വയസ്സായി 40 വയസ്സായി ഇനിയാണോ എക്സസൈസ്, ഇനിയാണോ ഡയറ്റ് എന്നുള്ളതല്ല. ഹെൽത്തി ലൈഫ് എന്ന് പറഞ്ഞാല് കുട്ടികളെ തൊട്ടേ എല്ലാം നമ്മൾ എന്ന് പറഞ്ഞ് ബേക്കറികൾ മുഴുവൻ അടച്ച് പൂട്ടുക, ഒരിക്കലും കേക്ക് കഴിക്കുക, അങ്ങനെയൊന്നുമല്ല. ഇതിന്റെയൊക്കെ ഒരു അളവ് കുറയ്ക്കുക. ജനറലി കഴിക്കുന്നതെല്ലാം നമ്മൾ ഹെൽത്തി ആയിട്ട് കഴിക്കുക. നമ്മുടെ വീട്ടില് ആ ഭക്ഷണം മാത്രം അവൈലബിൾ ആക്കുക. മറ്റേതൊക്കെ അൺഹെൽത്തി ആയിട്ടുള്ളത് ഇസ് വൺസ് ഇൻ എ വൈൽ. പലപ്പോഴും കുട്ടികളെ ഇപ്പൊ പരീക്ഷയ്ക്ക് മാർക്ക് വാങ്ങിക്കുക, ഒരു ട്രീറ്റ് കൊടുക്കുക എന്ന് പറഞ്ഞിട്ട് ബേക്കറിയിൽ നിന്നാണ് കൊടുക്കുന്നത്. ഓൾവേസ് ലിങ്ക് such pleasurable things with something else. Once in a while is okay, but I think we have to target from children. There is no evidence on കഞ്ഞി കൾച്ചർ. ശരിയാണ്, കഞ്ഞി അത്ര ഒരു നല്ല ഹെൽത്തി സാധനമല്ല. ഈ പൊറോട്ട ഒഴിവാക്കി കഞ്ഞി കുടിക്കണം എന്ന് നമ്മൾ പറയുന്നില്ല. Parotta, maida is also wheat. Wheatil fiber illata sadhanamana maida. Kanji valare nalladum parota valare മോശവും എന്നല്ല. കഞ്ഞിക്ക് ഗ്ലൈസമിക് ഇൻഡെക്സ് കുറവാണ്, കാരണം അത് അരിയാണ്. പക്ഷെ നമ്മൾ അളവിൽ ഇപ്പൊ കഞ്ഞി കുടിക്കാൻ പാടില്ല എന്നുള്ളതല്ല, കഞ്ഞി അല്ല ഞാൻ ഈ പറയുന്ന ഐഡിയലി നമ്മൾ ആ സിറിയൽസിന്റെ അളവ് കുറവ് തന്നെയാണ് വേണ്ടത്. ഇപ്പൊ കഞ്ഞിയും പയറും എന്ന് പറഞ്ഞാൽ അതിനകത്ത് വെജിറ്റബിൾസ് വരുന്നതേ ഇല്ല. ഇപ്പൊ ഞാൻ റെവല്യൂഷനൈസിങ് കിച്ചൺ എന്ന് പറഞ്ഞത് ഇപ്പൊ ഈ ഗോതമ്പ് കൊണ്ട് നമുക്ക് പുതിയ കാര്യങ്ങള് സ്റ്റീം ചെയ്ത കാര്യങ്ങളോ ഒക്കെ ഉണ്ടാക്കാൻ പറ്റുമായിരിക്കും. ഞാൻ today I may be exceeding time. If there is some other time, I'll discuss that. So പറോട്ട കൾച്ചർ എന്ന് പറയുന്നത് നമ്മള് ഈ പൊറോട്ട ഒരിക്കലും കഴിക്കാൻ പാടില്ല എന്നുള്ളതല്ല, പക്ഷെ സ്ഥിരമായിട്ട് പൊറോട്ട കഴിക്കുന്നത് നമ്മൾ ആലോചിക്കുക. നമ്മുടെ ചില ഇപ്പൊ ഈ കോൺക്രീറ്റിന് വാർക്കുന്നവര്, ഞാൻ പലപ്പോഴും ശ്രദ്ധിച്ചിട്ടുള്ള ഒരു കാര്യമാണ്, അതിന്റെ ഡേറ്റ ഇല്ല, പക്ഷെ എല്ലാ ദിവസവും ഈ വാർക്കുന്ന ദിവസം പൊറോട്ട ആയിരിക്കും. അപ്പൊ അവര് മിക്കവാറും ദിവസങ്ങൾ ഇപ്പൊ ട്രീറ്റ് ഉള്ള ദിവസങ്ങൾ എല്ലാ ദിവസവും റെഗുലർ ആയിട്ട് പൊറോട്ട എന്ന് പറഞ്ഞാൽ പൊറോട്ടയിൽ എങ്ങനെയാണ് ഉണ്ടാക്കുന്നത്, അതിനകത്ത് ട്രാൻസ് ഫാറ്റി ആസിഡ് ആണ്. ഡാൽഡ വെജിറ്റബിൾ ഓയിൽ അൺസാച്ചുറേറ്റഡ് ആണ്, അതിനെ ഹൈഡ്രജനേറ്റ് ചെയ്യുമ്പോൾ അത് ട്രാൻസ് ഫാറ്റി ആസിഡ് ആണ്. ട്രാൻസ് ഫാറ്റി ആസിഡ് അത്രോജനിക് ആണ്. മൈദ ലെയർ ആയിട്ട് ഇളകുന്നത് അതിനകത്ത് ഫാറ്റ് ഉള്ളത് കൊണ്ടാണ്, അതിനകത്ത് പിന്നെ ഡാൽഡ ചേർക്കുന്നത് കൊണ്ടാണ്. അപ്പൊ അത് കഴിക്കാം, പക്ഷെ സ്ഥിരമായിട്ട് അത് കഴിക്കുമ്പോൾ നമ്മളുടെ ഫാറ്റ് കൺസംഷൻ കൂടും. അപ്പൊ മോർ ദാൻ ദ മൈദ, I think that oil and the regularity of use എന്നുള്ളതാണ് അതിന്റെ പ്രശ്നം. Regarding alcohol in the overall കേരളത്തിന്റെ മോബിഡിറ്റിയില് there are many previous studies on alcohol. Moderate consumptionile ഉപയോഗം എന്നൊക്കെ പറഞ്ഞിട്ട്, and there is I think 2019 end Lancet, there was a review article which has said that the overall benefit ആൽക്കഹോൾ കൊണ്ടുള്ള ഓവറോൾ ബെനിഫിറ്റിനെ കഴിയും ഒരുപാട് ആൽക്കഹോൾ കൊണ്ടുള്ള ഹാം തന്നെയാണ്. വി ആർ നോട്ട് ടോക്കിംഗ് അബൌട്ട് ബാൻ ഓഫ് എനിത്തിങ്, ബട്ട് alcohol use in Kerala is definitely related to several morbidities, not only cirrhosis, but then the cost involved in accidents. As we know, there was a 30% reduction in the number of accidents into 2020. നമ്മുടെ 29,000 മരണമാണ് 2019 2020 വന്നത്. അതിൽ ഒരു 30% റിഡക്ഷൻ ആക്സിഡൻസിനകത്ത് ഉണ്ടായിരുന്നു. അപ്പൊ അതുകൊണ്ട് ആൽക്കഹോൾ നമ്മുടെ കുട്ടികളുടെ അല്ലെങ്കിൽ ആൽക്കഹോൾ യൂസ് കൂടുന്നുണ്ട് എന്നുള്ളതാണ്. അപ്പൊ അത് ഡെഫിനറ്റ്ലി പബ്ലിക് ഹെൽത്തിൽ ഇഫ് ദർ ഇസ് വൺ ഓഫ് ദി ഇന്റർവെൻഷൻസ് വിച്ച് ക്യാൻ മേക്ക് എ ഡിഫറൻസ് ഇൻ സെവറൽ health related outcomes including accidents is intervening in alcohol. So it is not about ban and all, but then prevention and control of alcohol related problems is important, and targeting children and teaching them how to derive pleasure, activities which they like, not related to drugs and alcohol. ഇതാണ് ഒരു ഇന്റർനാഷണലി ഒത്തിരി എക്സ്പെരിമെന്റ് ഔട്ട് ചെയ്യുന്ന പല ഇന്റർവെൻഷൻസിൽ ഒന്ന്. പലപ്പോഴും ഒരു മീറ്റിംഗിൽ ഇതില് കുറെ പേരാണ് അബ്യൂസിലോട്ടും അല്ലെങ്കിൽ ഡിപ്പെൻഡൻസിലോട്ട് പോകുന്നത്. അത് നേരത്തെ ഐഡന്റിഫൈ ചെയ്യാന്നൊക്കെ ഉള്ളതാണ്. I think I am exceeding my time.
Ma'am, we have messages from Dr.Muralee Thummarukudy, sir, for you. Sir has expressed, thank you, Dr. Indu, for your very interesting talk. I have been arguing in the social media for a long time that Kerala will not get out of our high morbidity paradox unless we stop eating so much of rice processed foods. Due to our love for heritage and nostalgia, we still use this big rice plate. Also, nostalgic food combinations such as kanni uppa, pappadam, and pickle is actually a deadly combination as it adds too much salt and carbohydrates. The suggestion for policy price signal is good. And there's one more message from sir. I also find it a problem when we really have no information on either calorie or balanced diet for Kerala specific foods. For example, how many calorie is a urunna vada or how much fat is there in a package of chips. We also don't know how many calories is a Malayali sadhya. These days in a buffet lunch, probably we are eating twice as much as what we should. If there is somebody working on this topic, I will happy to be connected. We need to really create more awareness and put up in menu cards as they do in the West.
Thank you, Sandhya. Thank you, Dr. Muralee. Actually, I have 2 points here. One is that we have been part of a multicentric study on the calorie and of commonly used food items. So we have sent samples. We have data of commonly used food. അതിനകത്ത് ഉഴുന്നുവട, ബിരിയാണി ഇങ്ങനത്തെയൊക്കെ ഉണ്ട്. അപ്പൊ അതിനകത്ത് ഏതൊക്കെ ട്രാൻസ് ഫാറ്റ്, ഷുഗർ, സോൾട്ട് ഇതിന്റെ എല്ലാം കണ്ടന്റ് നോക്കുന്നുണ്ട്, അനലൈസ് ചെയ്തിട്ടുണ്ട്. ഐ തിങ്ക് ദി മൾട്ടിസെൻട്രിക് സ്റ്റഡി ദേ release the results, so that is going on. And then we have also have the morbidity profile also. The data is being analyzed. That's one. So that will be available, and I totally agree with his viewpoints. See, നമ്മൾ ഈ വട എന്ന് പറയുന്നത് ഇപ്പം ഡയബറ്റിസ് ഉള്ളവർക്ക് വട കഴിക്കാമെന്ന് പറഞ്ഞിട്ട് ഈ വട പഞ്ചസാര അല്ലല്ലോ എന്നാ പറയുന്നത്. പക്ഷെ അത് ഇപ്പൊ ഇതൊന്നും ഉഴുന്നുവട നിരോധിക്കാൻ വേണ്ടിയിട്ടല്ല, പക്ഷെ റെഗുലർ ആയിട്ട് എല്ലാ മീറ്റിങ്ങുകളിലും എപ്പോഴും ട്രെയിനിൽ അവൈലബിൾ ഒക്കെ വടയാണ്. അപ്പൊ ഇത് നമ്മള് സദ്യ വെജിറ്റേറിയൻ എന്ന് പറഞ്ഞാൽ നമ്മൾ ആവശ്യത്തിനുള്ള എത്രയോ 2000 ഒക്കെ കാലറി കാണുമായിരിക്കും വലിയ ഒത്തിരി പായസമുള്ള സദ്യയിൽ. അത് കണക്ക് കൂട്ടി നോക്കണം. ഇത് കണക്ക് കൂട്ടാൻ എന്ന് പറഞ്ഞാല് നമ്മളിപ്പോ ഒരു ഫ്രം ഡ്രൈ വെയ്റ്റ് some approximate calculations are there. So that's one. And from government, the food safety department has an initiative. അതില് എനിക്ക് തോന്നുന്നു കഴിഞ്ഞ 2020 ആദ്യം ക്യാമ്പയിൻ ഫുഡ് സേഫ്റ്റി ആയിട്ട് അത് ലോഞ്ച് ചെയ്യുന്ന ജനുവരിയിലാണ് അത് ലോഞ്ച് ചെയ്തത്. അതിന്റെ ഒരു 1-2 ആഴ്ചകൾക്കകമാണ് കോവിഡ് വന്നത്. ഇറ്റ് ഡിഡ് നോട്ട് ടേക്ക് ഓഫ്. Hopefully the next government, not only government, this is not only a government affair. Of course government should, because some regulatory measures are also there. For example, trans fat reduction. ഇപ്പൊ ഈ എണ്ണ തിളപ്പിച്ച് ഉപയോഗിക്കുമ്പോൾ അതിനകത്ത് ട്രാൻസ് ഫാറ്റി ആസിഡ് വരുന്നുണ്ട്. കാലറീസ് വേറൊരു ഇഷ്യൂ. ഓവറോൾ ഒബീസിറ്റിക്ക് കോൺട്രിബ്യൂട്ട് ചെയ്യുന്ന ഒരുപാട് ഇഷ്യൂ. അപ്പൊ ഇതിനകത്ത് തന്നെ ഒരുപാട് കാര്യങ്ങളുണ്ട്. അപ്പൊ അതിന്റെ അവയർനെസ് ഇസ് വൺ, റെഗുലേറ്ററി ഇസ് വൺ, ടെല്ലിങ് പീപ്പിൾ വാട്ട് ടു ഈറ്റ്. ആളുകളുടെ അറിവ് ആണ് അവരെ എന്ത് കഴിക്കണം അല്ലെങ്കിൽ എന്ത് കഴിക്കണ്ട എന്ന് തീരുമാനിക്കേണ്ട. അപ്പൊ അതിലൊന്നും നമ്മളിപ്പോ പറോട്ട പാടില്ല, അതല്ലെങ്കിൽ അത് പാടില്ല, ഇത് പാടില്ല എന്ന് പറയുന്നതിന് പകരം ഇതൊരു ഇൻഡസ്ട്രിയാണ്. ഈ ഇൻഡസ്ട്രിയിൽ ബേക്കറിയിൽ എന്ത് വിൽക്കുന്നത് ആളുകൾ എന്ത് വാങ്ങുന്നു നോക്കിയിട്ടാണ്. അപ്പൊ അതുകൊണ്ടാണ് ഹെൽത്തി കൗണ്ട്. ഐ തിങ്ക് ഹി ഹാസ് ഓൾറെഡി മെൻഷൻഡ് അബൌട്ട് മെനു കാർഡ്സ്. if there is an area where healthy food is being served, most of the days people may eat from there, and once in a while they'll indulge in other high calorie items. So all these are possible, but then we have to work on it. I think Kerala, it's high time that we think about or understand the burden of non-communicable disease. Otherwise, the number of patients who are on dialysis. I think politicians also need to be sensitive. We have very eminent political leaders at the national level and all, who have undergone continuously under transplants and all. So there is, though literacy alone is not enough, we have to have real understanding on what we eat and how healthier we need to be. Thank you for that question.
Thank you, ma'am.
Yeah, there are many strengths in the conventional things, but then we have to have science in it. It's not emotion, right? We have to have science in it. നമുക്കുള്ളത് പണ്ടുള്ളത് എല്ലാം നല്ലതും പുതിയതെല്ലാം മോശവും ഒന്നുമല്ല. അതിൽ കുറെ കാര്യങ്ങൾ നല്ലതാണ്, കുറെ കാര്യങ്ങൾ നമ്മൾ മാറ്റേണ്ടതാണ്.
Thank you so much, ma'am. If there are no more questions, is there any questions to be asked or discussed with our eminent speakers from the participant side?
I think since Dr. Muralee's final word is, if there is somebody is working on this topic.
Excuse me, madam. One question. Indu madam, I am Krishnankutti, Kerala Shastra Sahitya Parishad.
Namaskara, sir. Sir ഉണ്ടായിരുന്നതല്ലേ?
മാഡം, നമ്മുടെ പിന്നെ ഞാൻ കഴിഞ്ഞ ഏപ്രിൽ 2020 ഏപ്രിൽ 27 എനിക്ക് എമർജൻസി ആയിട്ട് ആൻജിയോപ്ലാസ്റ്റി ചെയ്യേണ്ടി വന്നു പോയി. അപ്പം ഈ ഹോൾ എഗ് ഇന്റർവെൽ എത്ര പീരീഡില് കഴിക്കാം? ഹോൾ എഗ്
ഹോൾ എഗ് 2 to 3 per week ആണ് നമ്മൾ, പ്രത്യേകിച്ച് എന്തെങ്കിലും പ്രശ്നമുള്ളവർക്ക്. കാരണം ഞാൻ നേരത്തെ പറഞ്ഞ പോലെ ഒരു മുട്ടയിൽ 250 milligram കൊളസ്ട്രോൾ ഉണ്ട് സർ. പക്ഷെ എഗ് വൈറ്റ് ഇല്ലേ, മുട്ടയുടെ വെള്ള പ്രോട്ടീൻ ആണ്. അതിന് ഇതുപോലുള്ള നിയന്ത്രണങ്ങളില്ല സർ. ഒരു മുട്ടയിൽ 6 gram പ്രോട്ടീൻ ഉണ്ട്, 6 gram ഫാറ്റ് ഉണ്ട്, 250 milligram cholesterol ഉണ്ട്, ഏതാണ്ട് 70 കലോറിയും ഉണ്ട് സർ. അപ്പൊ അതുകൊണ്ട് ബാക്കിയെല്ലാം പ്രശ്നമില്ല. പക്ഷെ എനിക്കൊന്ന് എല്ലാ ദിവസവും ഈ മഞ്ഞ ചേർന്ന ഭാഗമുള്ളത് അങ്ങേപ്പോലുള്ളവർക്ക് അത്ര ഒരു
വല്ലപ്പോഴേക്ക് ഉപയോഗിക്കാറുണ്ട്.
ഓക്കെ സർ.
ഓക്കെ, താങ്ക് യു.
Thank you, sir.
Thank you, ma'am. Any more questions?
Hello.
Kelkam, pare. Yeah, I can hear you.
Yeah, I think I had put it in the chat box asking to Madam Latha.
Okay.
Latha Madam, I'm
Yes,
Regina.
yes.
Madam, I'm
Regina.
Regina.
Okay. I have seen that.
It's a nice class. I just want to know whether in Kerala, in the meat industry, do we have a regular checkup with the meat inspection and all? Is it going on?
No, madam. Actually, I have answered for that, and actually, nothing is happening. As I thought, means in our college, in association with our college, we have a modern meat plant where the hygienic meat production is carrying out. Everything is under pakka hygienic thing. But and we are giving training to many people on this hygienic meat production and all. And actually, panchayat level, they have started with the this starting of this slaughterhouses, small slaughterhouse units and all, but nothing is materialized. And whatever we have seen in the streets and all, it should be banned. And if that's what I was telling, not only the authorities, the consumers also have to take action. If they are taking the decision that they won't buy from such butchery shops and all, that is also very important.
I think we can take up the matter, because we keep seeing even people are not even examined. I think even people also, as you said, the nails, dirty nails and all those things. Can we take it up in any government sector? Can we put some research?
Yeah, that research and all means it's very visible. No, there is no hygienic production, and it will be contaminated. It is contaminated, no doubt in that. And actually, it should be taken at the government level. And many projects have written on that at the panchayat level and all, but not fully materialized.
Hope new situation will take care of it. Okay, thanks a lot, ma'am. Thank you. Thank you so much.
Thank you.
Thank you, ma'am. There's one more question
on polished rice. Unpolished rice is better. അതിനകത്താണ് പോളിഷ്, അല്ലെങ്കിൽ നമ്മൾ പുഴുക്കലരി എന്ന് പറയത്തില്ലേ, പാർബോയിൽഡ് റൈസ്. പാർബോയിൽഡ് റൈസ് ഇസ് ഡെഫിനറ്റ്ലി സുപ്പീരിയർ ടു പോളിഷ് റൈസ്. വെളുത്ത ചോറിനേക്കാളും നല്ലത് ചുവന്ന ചമ്പാവരി ചോറാണ് നല്ലത്. കാരണം അതില് തൈമിൻ അങ്ങനെയുള്ള മൈക്രോ ന്യൂട്രിയൻസ് കൂടുതലുണ്ട്. അപ്പൊ അതായിരുന്നു ഒരു ചോദ്യം. അളവിൽ ചോറിന്റെ അളവ് കുറയ്ക്കണം എന്നുള്ളതാണ് കാര്യം. അടുത്തത് ഒരു many vegetarians or non-smokers, non-drinkers are victims of heart attack. I think I've already explained. So what matters is not whether you are a vegetarian or a non-vegetarian, but you should have a healthy diet. Even vegetarians, നമ്മള് കൊടുവയറ് ഞാൻ നേരത്തെ പറഞ്ഞില്ലേ, അപ്പൊ അതിനകത്ത് even cereals. See, fruits and vegetables protect. We should include the amount of fruits and vegetables which are going to protect us. We should reduce the amount of cereals. We have to reduce salt, sugar and fat. We have to walk more. Physical activity has to be. വണ്ണം കുറയണമെങ്കിൽ ഡയറ്റും ആരോഗ്യം കൂടണമെങ്കിൽ നടത്തും, എക്സസൈസ്. ഇത് രണ്ടുമാണ് അതിന്റെ കീ. Physical activity also is very poor. നടപ്പ് പോലും ഇല്ല.
Thank you, ma'am. There's a message for Latha, ma'am, from Dr.Muralee Thummarukudy.
Yeah, I have seen, sir. Fish also, nowadays online business is taking place, but fish also, this hygienic handling and those things are lacking in our country, at least in our country and all. We have to go for the hygienic handling and such things. So for all meat also actually hygienic meat production is taking place in many of the slaughterhouses, especially the MPI. There is one slaughterhouse, then ours is there, then this Wayanad district, they have started one, Brahmagiri one slaughterhouse and all. So almost all the panchayats and all, it should be.
Thank you, ma'am. Any more questions from the participants side? if there are no more questions, we would like to conclude the session with a brief vote of thanks. For this, I would like to invite Dr. Anup Kumar for the vote of thanks. Over to Dr. Anup Kumar.
Thank you, Sandhya ma'am. To conclude this session, I would like to express my sincere thanks to our Honorable Vice Chancellor, Professor Dr. Kundumal sir, for giving us the opportunity to conduct the program. Thank you, sir. Sir's invaluable guidance has motivated us to conduct the program in a successful way. I extend my gratitude to our Pro Vice Chancellor, Professor Dr. C.P. Vijayan sir, for providing us the insights and expertise that helped us to overcome the hurdles in conducting this program. I would like to thank our Registrar, Professor Dr. A.K. Manoj Kumar sir, for the timely support and help. I would also thank our Controller of Examination, Professor Dr. Anil sir, Dean Research, Professor Dr. Shaji sir, Dean Student Affairs, Dr. Iqbal sir, for all the timely support and advice. I express my deep sense of gratitude and hearty thanks to all the three eminent speakers of today's session, Dr. Muralee Thummarukudy sir, Dr. Latha ma'am, and Dr. Indu ma'am. All the three dignitaries graced the occasion with extremely informative talks in a very diligent way. Thank you so much, Dr. Muralee Thummarukudy sir, Dr. Latha ma'am, and Dr. Indu ma'am. And I sincerely hope all the participants have benefited from the excellent interactive sessions. I'm also thankful to an excellent IT support by Mr. Aryal sir and team, Joint Registrar Dr. Geeta ma'am and team for all the support given. Last but not least, I thank all the distinguished participants who have participated in this program, making this a lively, active and successful session. Once again, on behalf of Kerala University of Health Sciences, we thank each one of you for your kind participation and cooperation. Thank you. Have a wonderful evening.
Thank you.
Thank you. Bye-bye.
Thank you, everybody. Thank you so much.
Thank you. Bye-bye.
Thank you all.
Thank you.
പാറശാല 4:20 വിട്ട പാറശാല 4:50 5 മണിക്ക് എത്തുമായിരിക്കും. 5:10 എത്തുമായിരിക്കും. 5:10 അരമണിക്കൂർ 40 മിനിറ്റോ മറ്റേ മതി.